Right. Welcome, everyone. I am Jamie Strauss-Clark, your facilitator. It's nice to see your faces and your names there. This is the Crisis Response Improvement Strategy Committee meeting number 9 and our last meeting of 2022. So congratulations on making it this far. Before we dive into the agenda items, I just want to take a couple of moments to do our usual drill about the Zoom features and how we're going to engage with each other today. As a reminder, I have 2 slides. The first one is meant for CRIS committee members, and then the next slide after this one is for our community members who are attending and observing today. So CRIS committee members, just a few reminders from Zoom. If you could please keep your mics on mute unless you are asking a question or speaking. And Brittany, if you could just highlight that red. There we go. Mic's on mute. That will keep some of the background noise from disrupting the proceedings. If it is available to you, both from a bandwidth standpoint personally and from your internet, if you could keep your video cameras on, particularly during the discussion portions of our meeting today, that really does help us engage with each other, almost as if we were in a physical space together. You can click ahead there, Brittany. We use the raise your hand function to indicate when we want to make a comment or ask a question. And to find that, you'll click on that reactions button on your toolbar, and then that'll pop up a window and you'll see the raise your hand button there. If you are participating via phone today, I think it's *9 to raise your hand. And of course, always welcome to wave your arms like this, and I will look out for you and try to call on you in the order in which I see you. Also, for those of you who prefer to communicate in written form rather than verbally, you may use the chat function and chat with me, Jamie Strauss-Clark, and I will intersperse your questions or feedback with calling on people raising their hands. And that chat button, you'll see the red arrow indicating that. If you could click ahead, Brittany. Finally, if you would like to see as many of you as possible on the screen, you can click on that speaker view and choose gallery, that button, and then choose gallery view, and that will show as many folks as possible who are on their video cameras. All right, let's click ahead to the slide intended for members of the public. So members of the public, similarly, if you could please keep your mics on mute unless you are participating in the public comment at the end of the meeting. There's also going to be a point, which we've done in the past, later in the meeting where I'll be facilitating a conversation with community members in the main room, and that will be another opportunity for you to turn your mics off. Click ahead, please. So community members, I'm going to ask that during the discussions where all the CRIS committee members are engaging in conversation, that you keep your video cameras off. That really allows us to facilitate the conversation with the CRIS committee members. There's 72 of you on. I'm expecting even more to show up. And so it really does help me as the facilitator distinguish between the 37 CRIS committee members who are attending and community members and guests who are attending. The exceptions are, as I said, later in the meeting, we'll be having a community conversation that I'll be facilitating here in the main room. And that will be a great time for you to turn on your video camera if you would like. And also when we do public comment, if you've signed up to make public comment, I will ask you to turn your video camera on if you can when you're making your comment. You can click ahead, please, Brittany. And again, you may use that speaker view button at the top right to change to gallery view if you'd like to see everyone. One more note, we do have ASL interpreters here today, Abel and Lori. They will be switching off every 15 minutes. And they have been pinned. So if you are using ASL interpretation, you should see them on your screen the whole time. Finally, before we move on, I just want to remind folks who've signed up to do public comment at the end of the meeting, we have reduced that time to 10 minutes from the original 20, just due to the number of people who are signing up to do it. I'll provide more instructions at the end of the meeting, but for now, I'm anticipating comments to be 2 minutes per person. I'll call on you in the order in which you signed up, and we'll definitely preserve that time at the end of the meeting for public comment. Okay. Oh, and actually one more reminder, CRIS committee members, if you could, when you speak today, just before you start speaking, if you could say your name and the agency or organization you're representing on the CRIS, your pronouns, that would really help our community members and your fellow CRIS committee members remember who's who and who's involved in this CRIS committee. All right, I would like to stop talking for a moment and turn it over to one of our steering committee members, Bipasha Mukherjee, who's going to offer some words of welcome today. And Brittany, if you don't mind closing that, perfect. Thank you. So Bipasha, take it away. You're on mute, Bipasha.
Always, I will get that wrong. Okay. Thanks, Jamie. I am a person with lived experience in the CRIS and the steering meeting. I've had more than my share of being grumpy about the 988 process over the past 15 months. Nice way to start a welcome, eh? There are a lot of things to address, work through, fix, for sure. But in reading the report, I realized how much work has already been done. There were 58 meetings across CRIS, steering, and subcommittees. And that doesn't include hundreds, if not thousands, of other smaller or one-on-one meetings, conversations, texts, emails, chats, as people try to figure out how to collaborate on this complex cross-system bill. The report said that although overall the suicide rate dropped by 1% in Washington from 2021 to 2022, the American Indian and Alaska Native population saw the highest increase in rates of 59%. Sobering. Then I attended the launch of the Native and Strong Lifeline this November. I heard tribal members and elders speak of their historic pain and hope that this country will do better by them. How meaningful it was for them to see this line launched. Let me emphasize, Washington is the first and right now only state to have a press for option after dialing 988 for tribal members to get support from someone who has a deep understanding of their culture because they're a part of it. So despite our disagreements, big or small, Washington did that. I left touched by hope and a desire to do better. Even if we've had uncomfortable moments, failed at times, I see people trying to learn, grow, get back on the horse because each of us believes in the importance of this work. Thank you all for showing up again today. And finally, I want to give a shout out to Bob, Javi, Jen, Jim, Laura, Puck, Melanie, Michael, Seka, Shoma, Topher, those who have made public comment, the people with lived experience who have generously shared their stories so we may stay grounded in who we are actually serving. Let's continue to keep this as our North Star as we close out 2022 and look ahead to continuing this journey in 23 by digging deeper, doing better, and doing more. Welcome.
Thank you so much, Bipasha. And along those lines and some of the words that Bipasha shared today, we were thinking this is typically the time when one of our agency representatives to the steering committee shares a land acknowledgement. And today we wanted to do something a little bit different. Let me see if Rochelle, are you with us? Just want to make sure we're still on.
I am here. Yes.
Oh, wonderful. So Rochelle Williams with Volunteers of America is with us today. You may remember that VOA is administering the Native and Strong Lifeline, and we wanted to use this time to take a moment to celebrate that tremendous accomplishment of the launch of Native and Strong. And so I'd like to turn that over to Rochelle to say a few words.
Hi, everybody. Thank you for having me today. Thank you, Jamie, for the invitation for us to be here to share this with all of you. Bipasha, your words were beautiful. Thank you. And I'm so glad that you attended also. We weren't sure that we would have a lot of attendance, right? We weren't sure how this was going to be or what the volume was going to be like. Nobody knew. And we have really high hopes for this program. And it's working really well. And so even with we didn't really do a lot of advertising around it because, again, we weren't really sure that it was going to come to fruition, right? Like, we don't know for sure. We don't know anything for sure. But what we do know is it's running now. It's a good thing. We are getting calls. And we are, Native American people, American Indian people, I believe we're less than 2% of the population, and I could be a little bit fuzzy, but I know that our suicide rates are much higher, even for this tiny percentage of the population. And even for that tiny percentage of population, not only just being located in Washington state, but all across the country, we are still getting a good volume for the amount of people that are Native that would be calling our line. And so again, those of you that are familiar, I know lots of you are, but those of you that aren't, our tribal crisis counselors are trained just like Lifeline counselors are, with traditional elements incorporated into their training, focus on intergenerational and historical trauma, and other elements that are important to us. We are open 24/7. And 365. So there are really no differences other than when you're an Indigenous person who is in need of support, you can call us and know that there's going to be another Native person on the other end of the line. This is already comforting for a lot of people. This I know for myself, being an Indigenous woman, and I know for my family and friends that this is something that is extremely important, because now we don't have that we don't have to take extra time when we're in crisis or when we need support to discuss who we are collectively as a people. That's already taken care of, because we know that even if this person is not from our tribe, they are from a tribe. And so we do have some of those similarities. And so we know that that piece is already taken care of. We don't have to worry about explaining who we are or explaining some of our slang terms, because that's already known. So we can eliminate all that. And so now we can just talk about what our needs are. And sometimes there have been times when callers have called just to celebrate something. And I think that's interesting, because to me, that tells me that this is also preventative, which is extremely important. So maybe this person didn't have anyone else to call. Maybe this person didn't have anyone to celebrate with, but they knew that they could celebrate with other Indigenous people by getting in touch with us. And so that's a feeling that, to celebrate that and to have that connection automatically to know who you can call is huge. And I think that's very preventative, because you don't have someone who's just sitting there wishing they had somebody to celebrate with. They were able to do that with us. Every call has definitely not been celebratory, that's for sure. But that's the purpose. We want to be there for all these needs. We want to be there to support every Indigenous person, not just enrolled tribal members. That's really important to acknowledge once again, because lots of us are not enrolled. I'm fortunate to be an enrolled member of the Hadasat First Nation, but I'm also a descendant of the Tulalip tribes. That doesn't get rid of my entire bloodline because I don't have a plastic enrollment card. And so we want it to be known that there are lots of families where some of us are enrolled and some are not. And we are here to serve everybody. We're also not here to replace any tribally operated service. And I know that that was something that a lot of the tribes were questioning. Maybe we were going to swoop in and kind of take over, and that is absolutely not it. We are just here as an option. We are just here for those that might want to utilize our services, and they absolutely don't have to if they don't want to, but we are so happy that they are doing so. One of the updates that I would give you all is that we are working with different media outlets right now on really driving home who we are and getting that news out locally. So we have a couple of nice things coming up with King 5, where they are going to be doing a Native American special, which I believe is a 30-minute special on facing race. And they invited us to come and do an interview so that we could discuss the Native and Strong Lifeline. So we should have a nice segment airing a couple of times this month. I believe it will start on the 20th is when it will start to air. And this is important because I know as a Native person, it's very rare to get this kind of attention for anything. It's rare to see ourselves represented on television. So if I hear there's going to be a Native special, I'm like, oh, I'm totally going to watch that. I totally want to watch that. So I imagine that there should be lots of Native people that are going to see what we're doing in the Native and Strong Lifeline in that way through King 5 and I believe Q13 as well. And so, just be on the lookout for those things because they're really important. And I notice on social media, I'm seeing tribes. We reached out to all the 29 tribes and some of the not federally recognized tribes as well. I think that's really important. So we reached out to all of their media outlets to share with them who we are, what we're doing, and give them our social media posts. And so I'm noticing a lot of sharing in all the different tribes. So people are getting the message out, and we are grateful for that. We don't like calling this a pilot program. I don't know if people appreciate that or not, but I would call it a model because we have other states who are already reaching out to us and asking how they can take this and make it their own. And so I have a lot of hope for this program. I'm seeing it in action every day. Our counselors are very excited. They would love more call volume. But again, that comes with advertising. I know that there is now some funding for advertising that has been approved. And so we just started working on that. So we can bring a lot of attention to Native and Strong, as well as the Washington Indian Behavioral Health Hub, the sister program. So that is my update for you all.
Thank you so much, Rochelle. And I just want to take a moment for CRIS committee members and members of the community to celebrate this. I think I was talking with Vicki Lowe a few weeks about it. It really is a tremendous accomplishment. And I like it being a model. That's and hopefully a model for many states to emulate for years to come. So whether you want to use your reaction buttons or just do a little silent applause on your camera, let's all just take a moment to celebrate this accomplishment and the work of all the tribes in partnership to make this happen with Volunteers in America. So well done. Thank you. And thank you, Rochelle, for taking time to be with us today.
Thank you. I appreciate it, Jamie.
All right, let's just walk through our agenda today and also just ground us in where we've been, where we are, and where we're going. So objectives today, I just said the first one. We do have a few updates for you on state agency activities relevant to the CRIS Committee. And then we want to spend a good chunk of time reviewing and discussing your feedback on the draft progress report to the legislature. And we'll go over later on, we'll go over in a few slides, we'll go over the timing for gathering your feedback and then preparing for the steering committee meeting this Thursday to confirm direction to finalize it and deliver it to the legislature. We also want to discuss and get your feedback on how this progress report can support and inform our work for 2023. And then we want to spend the remaining part of the meeting gathering your reflections on CRIS committee work in 2022 to set the table for 2023, which is going to be a very roll up our sleeves and get a lot done kind of year. We'll confirm action items and next steps, and then as ever, spend the last 10 minutes of the meeting hearing public comment. So here, I'm advancing the slide, here's the timing that we're aiming for. So we're going to move right from here into updates at 2:20, and then we'll spend an hour doing a group discussion in the main room, getting your feedback on the progress report. I'm aiming for a 10-minute break at 3:40, and then when we come back at 3:50, we'll set up the conversation to go into breakouts. There'll be facilitated breakout rooms, and this will be when we discuss setting the table for 2023. We'll come back, do a share out, and then talk about action items and next steps, and then move into public comment period at 4:48. Adjourning at 5. If you could advance the slide, please. All right, just a quick overview of, and I know those of you who've reviewed the report probably, like Bipasha said, digested the breadth of work that's been done across all of the CRIS and subcommittees and agency staff and legislators this year. But as a reminder, we started in February working on our work plan and roles. We spent a focus of March on centering equity in our work. May was devoted to our vision and guiding principles. July was looking at crisis service gaps and goals. September and October, we did more dives into gaps, but also services and technology. The November meeting right before Thanksgiving, the focus was on legislation for 2023 and advising Senator Dinkra and Representative Orwell on issues that needed a legislative fix. In December is focused on the progress report. If you don't mind advancing, please. Okay, I do want to quickly just review the timeline for the progress report. You should have received it last week for your review, CRIS committee members. We're having our discussion today to get your feedback, and your written comments are due tomorrow. The steering committee is going to review your feedback on Thursday and then confirm next steps to finalize the report to the legislature and the governor. Deadline to submit is going to be on December 30th. And then the final recommendations from this committee will be included in our final report in January of 2024. I think that's it for my slides today. Just to make sure I didn't miss anything. Nope, that's it for my slides today. So let's move into our updates. And I'm going to start with Jane Beyer, who has an update on commercial insurance. Jane.
Hey, Jamie, thanks so much. So I wanted to just provide a brief update. Many of you probably know, I think I'd mentioned it before, that in legislation that passed this past session, the legislature essentially integrated behavioral health crisis services into how we think about emergency services in the private health insurance side of the world. And so just as somebody who has a medical emergency and walks into a hospital emergency room, gets treatment, whether it's in network, in their health plan network or out, and without the health plan having to approve it prior to receiving services, the same protection applies to individuals who get services from a mobile rapid response team, from a crisis triage facility, a crisis stabilization facility, a medical detox facility. And so with that accomplishment, we set about figuring out how to implement it, because for those of you who've been in the commercial health plan world, you know that there are two different cultures. Our behavioral health crisis system, right? Insurance blind, anybody gets services, and then you try to meld that with a private insurance world. And with the help of One Health Port, we have been working hard over the past several months with the insurance companies, with the behavioral health providers, and with the BHASOs, and with a lot of people coming to the table with compromises. We have sort of an initial structure for how we would implement this provision using the BHASOs, sort of the way they're used now for Medicaid, to really be sort of a network of providers for the health insurers to be able to work with in order to be sure that coverage is provided and that the providers are compensated for the emergency services that they're providing for people who have private health insurance. So there are still significant details to work out. The work is going to continue over the course of the next year. We have let the insurance companies know that by January 1 of 2024, they must have in place contracts with either the BHASOs or the behavioral health crisis providers, a sufficient number to meet the needs of the folks that are enrolled in their health plans. So a lot of work, but really people coming to the table in very, very good faith. And for those of you who are health insurance wonks and those of you who aren't, generally when the state legislature enacts laws that have to do with health insurance coverage, it only applies to health plans that are called fully insured health plans, which are the ones that we directly regulate in this office. There's a whole other universe of health plans called self-funded health plans that generally we can't regulate. So Boeing's health plan, Microsoft's health plan, Alaska Airlines health plan. And what is unique about cooperating with our federal partners is that for crisis services that are provided in facilities, so crisis triage, crisis stabilization, those self-funded group health plans are going to have to provide that same coverage for behavioral health crisis services that the fully insured health plans do. So it was an opportunity for the state to take action to bring services to people who are enrolled in self-funded health plans, which is pretty unique. So we really want to thank our federal partners for that one. But more to report. But for now, until the health plans have contracts with all of these providers, they are obligated to pay for those services. So if we can figure out who somebody's insurance plan is, then their health insurers will be responsible to pay for those crisis services. So I think that's it for me.
Thank you, Jane. Really appreciate it. I just posted in the chat another update courtesy of Bob Small. So please take a look at that. And when you get a chance, I'm going to turn it over now to, let's see, who do I have up next? I have Matt Gower and Kelly McPherson from HCA to talk about updates with next day appointments.
Sorry, I'm trying to find my camera and my mute button.
I know how that goes, Kelly. Thanks so much for being here.
Got too many buttons. All right, Matt, I'll go ahead and get started. I'm a little congested, so if I start to struggle, Jenny Harvell is on the phone, and I'll let her jump in. Since the last time we have met, HCA and DOH have been busy. Very busy working on the RFI. So the RFI is equivalent to window shopping, where there is no commitment to purchase, but simply an intent to capture a non-biased picture of what is available to solve the technology needs identified in House Bill 1477 and the technical and operational plan. So DOH and HCA are initiating that step now. So through the RFI, information will be gathered to inform a more granular technical specification needed to meet the functional requirements that were outlined in the plan, and to support the interoperability requirements between the different systems, those different ancillary systems that we had spoken about last time. The information gathered will also help to inform us of future state architecture and solution architecture diagrams will be created reflecting the detailed requirements. So the technical and operational plan recommended the following approach with the RFIs, and it was to publish those with the request to vendors to describe which parts of the different functionalities. You know, we have bed registry, next day appointments, that type of thing. So which functionality they were responding to, and to what extent, if at all, their solution would support the functionality, the other functionalities required in the bill. Are they interoperable? Will they be interoperable? What's that look like with the Vibrant Unified Platform? Describe the partnership with any other technology vendors to address all of those requirements. And then they needed to address the ability, describe the ability of the primary vendor to add, change, or decouple features and components as we move along in this work. So right now, that is what we're doing. So the RFI process, what we did is we created an RFI plan and vetted that with OCIO, our OCIO partners, and HCA and DOH sponsors. And then once we got approval from that, the RFI itself, it's really a book of RFIs. Like I said, all the different technologies. That went to internal DOH reviewers and HCA reviewers. So that was the first tier. Right now it's on the second tier, and they have until the 23rd of December to review and provide comments, and that is the OCIO, our regional crisis lines, our BHASOs, our MCRs, Matt Gower can talk to that in a minute, VOA. So right now, those folks have the RFI, so we'll be, like I said, receiving their input on the 23rd. And then it'll go to our tier 3 reviewers, which again is the OCIO, and then it's the governor's office. So that's Megan Celadoni and Amber Leaders. And then finally, it'll go to our executive review at HCA and DOH. And then it will go to the RFI approver, final approver will be Michelle Roberts, Carrie Waterland, and then it will get distributed to the Gov's office, OCIO, CRIS Steering Committee, the Technology Subcommittee, the tribes, and the SPL representative. So right now, that is what we're doing. That's what we've been busy doing. Yeah. Does anybody have any questions? All right.
Thanks, Kelly. I think, Matt, did you have anything you wanted to add? We've got about, you asked about time. We've got about 2 or 3 more minutes on this topic.
Yeah, absolutely. To Kelly's point, we did distribute the RFI to the regional crisis lines, mobile crisis response teams, and our BHASOs to take a look at the RFI to make sure that we're asking the right questions for the products we'll eventually buy. And I also did want to give a brief update on next day appointments. The work we've been doing around that has been tied very closely to the work for 1688 that Jane mentioned earlier. We did do a separate work group to kind of tease them out a little bit differently. The plan is to create a series of tools for our crisis workers to be able to connect somebody with their plan for that next day appointment. OIC has already emphasized that it is up to the insurance carrier to connect somebody to a next day appointment. Giving somebody a list of phone numbers and calling to see what's available just would not work for somebody in crisis. So that referral guide will go to the crisis workers, and crisis workers will also fill out a very brief tool to capture just kind of a little overview of what the presenting concerns are, the reason why a next day appointment was recommended, what to look for that next day appointment to help the plan schedule one appropriately, and to also help the clinician who eventually sees the person to understand the presenting problems and not have to ask a bunch of questions to clarify. We'll be rolling these tools out over the next week or 2, and then I'll be providing training over the next month for anybody interested on these tools to make sure that they have all the pieces and everything to get this rolling. And then we'll continue work to address some areas of capacity and further coordination to improve next day appointments along with the work that's going on for 1688. That's all I have. Thank you, Jamie.
Thank you so much, Kelly and Matt, for providing that update on next day appointments. Let's turn it over now to Michelle Roberts, who has a few updates on the 988 line. Michelle.
Good afternoon, everybody. Michelle Roberts from the Department of Health. I use she, her pronouns. Glad to be with you today, and just wanted to give a few high-level updates of what's happening with our 988 call centers and some pieces of work that the Department of Health is responsible for. So just want to let you know that our in-state answer rate continues to be really high, hovering right about 90%. So really thankful for all the work our 3 call centers are doing to do that and continue. So thankful for the investment we've made as a state to help the call centers be able to staff and answer at that volume. So that's great news. Some of you may have seen that there was a nationwide 988 outage that occurred on December 1st for calls. Text and chat messages were still going through. So this was happening on the nationwide, and little we could do to address it, but thanks to everybody who helped us amplify the messages. The good news is Vibrant, who administers this, the 988 calls and does all the triage of the calls nationwide. They implemented a temporary solution the next day on December 2nd, which helps route all the calls to a national backup center. Our national crisis center, our crisis centers are not part of the national backup center. So even though a temporary solution was in place, no calls were coming into Washington centers. So we're working, this is really a huge failure at the national level. So, and it was just not only the 988 calls, it was for other outages that use this one telephone system. So they still don't know the call or why, but or why there was this failure with the backup. But Vibrant has promised to send some FAQ documents with more information, including the number of calls that were missed during the outage. So this was a worst case scenario, and I think it's providing us a lot of opportunity to work as a state and with our national partners about what we need to do in the future and how can we be better positioned. And then Claudia, I've got some answers about what's going on with interpretation services. I know you have asked for a few times. I have some information, not to the level that people may be interested in, but that's something we could consider as we think about long-term about metrics. But all 3 of our call centers in Washington state have an interpretation service vendor. Each of the Frontier, Volunteers of America, and Crisis Connections each uses a different a different vendor, but that is in place. Right now, none of our crisis centers currently track or have access to the data regarding which languages are being requested and used most via those vendors for interpretation services. We do know about what's happening with the calls with state level metrics from Vibrant, because when you call into 988, there's the second option, I believe it's option 2, is to choose Spanish. And we have data on how many calls are going to that Spanish line. And so that is averaging around 161 calls out of several thousand calls each month, like 160-ish, sometimes as low. October was a low month for 67, but so, but we've got data on that piece, and then we have interpretation services available for all call centers for additional languages, and they can take Spanish that way too. The last piece I want to say is that we have been and have shared updates here about the work we're doing for rulemaking at the Department of Health. That was part of the requirements of 1477 legislation for the department to pass, to develop and pass rules related to crisis call center hubs. I just want to let you know that we're pausing some of those community engagement sessions. They will be held in the future, but we're working to build more time and capacity for engagement. We are also pausing to make sure we're appropriately engaging with tribes, honoring tribal sovereignty and our commitments under our government to government relationships. So we just wanted to make sure everybody knows that this is just a pause, and more will come in the future when we get those when we're ready to reschedule the sessions, excuse me for that. And that's it for DOH.
Wonderful. Thank you so much. Before we move on, any questions for any of our folks giving updates today?
I would just say, this is Claudia. Thank you for getting that information in terms of the interpretive services. Hopefully by 2023, we can drill down a little bit about different languages, and I will put that information into a possible plan for 2023 to track some of these translators and, interpret services, different languages, drop off calls when somebody come in a different language, because that's what we see a lot, right? People who are waiting to get interpretive services, and in the moment they start feeling a little uncomfortable and they drop the call. So it's little things that we can do in the future in 2023, but that will be probably the drill down. But thank you, Michelle. Thank you very much for getting the information. I appreciate it.
Thanks, Claudia. Bipasha, I see your hand.
Michelle, you said that the 3 call centers in Washington are not part of the 9 Vibrant Backup Center. Why is that?
I'm going to ask one of our call centers to answer that question, and we could also follow up with more information. I see Levi came off mute first, maybe.
Yeah, so great question, Bipasha. So there's a limited number of national backup phone centers and national backup chat text centers across the country, and there isn't one state for state. It's an RFP process with Vibrant to become one of those centers, and take some additional work because you are part of that network. So we at VOA operate as a national backup for chat and text, but not for phones. And so the nearest national backup phone center we have is Lines for Life in Portland, Oregon.
Thank you, Levi, for jumping in there. Any other questions before we move on? Okay, thank you so much to folks who gave updates today. We appreciate it. We're going to now move into discussion about CRIS feedback on the progress report. You should have received that on December 7th. Before we start the conversation, I want to turn it over to Senator Dinkra to set some context for all of us on how important this report is to their work. So, Senator Dinkra.
Thank you so much. Manka Dinkra, State Senator from the 45th Legislative District. I use she, her pronouns, and I'm so sorry, but I'm actually sick. Just a cold, but a horrible, horrible cold. So just bear with me. I feel like I say this all the time, but I continue to say this. I just want to thank all of you for all of your work and leaning into this work. And the result of all of that leaning in and engaging and showing up truly with the best of intentions in order to, go together to the shared vision that we all have to do better for Washington. To me, that's what's led to the draft of this progress report. And it's really important. I'll just say, I'll be honest, I don't believe all legislators will read all of it. I think they're probably going to read the highlighted part or the parts that's pretty and colorful, or see the graphs on the skimming component. So it is really important because it really shows that there's a huge coalition of people that are behind this report, that there's a lot of work that has gone in from so many different people, from so many walks of life. And that is the culmination that comes out in this report. It also doesn't mean that that is the last of it or that we won't engage, because while this report for this committee, we have a deadline that we're submitting it, for the legislature, it is the beginning of where they're going to get these recommendations from and how they're going to start the legislative process. So if you think you have already provided your feedback, you are so sorely mistaken, because there will be legislative hearings, there will be bills, and it would be wonderful if all of you on this call, anyone who's even listening, anyone who provides public testimony, will then log in to give public testimony on the bills and the recommendations on legislative changes that are made. So we are not at the end of our journey. This is just the first lap. So I just want to say that it is important, all those recommendations, all the input, but we still have more to do and more opportunities for that engagement and recommendations to be made. And that's what I actually love about this process, is because it gives us the ability to think about what all we want for an extended period of time. That we can still have those conversations, continue to think about these recommendations, and then when it comes time to the legislative session, be able to then articulate once again either the same position or provide more information or maybe change a position on something. So this continues to be an interactive process where there's so much more opportunity for people to continue to share your thoughts. But sharing your thoughts with the report is really important, because that is what some legislators will read cover to cover, others will skim through. But thank you so much. And I'm really excited to see how it's received and to see what next session looks like. Thank you.
Thank you, Senator Dinkra, and I'm sorry you got hit so hard by this cold. I hope it passes quickly. It's been a rough cold and flu season for a lot of people. I think our immune systems are like newborn babies right now. So I'm going to ask Betsy to just walk you through the format. Before I do that, looks like Representative Orwell would like to say a few words too. Representative Orwell.
Yes, thank you. I just also want to say thank you. I know there's been a tremendous amount of work done, and it's such a complex process. So a lot of good things in the report. We want to continue to hear your feedback. There's a couple of things I wanted to share. One is I'm at the Nisquamish tribe today, and we have our advance for the House Democrats. And I'm very pleased to say that in their top 4 priorities, behavioral health is in the top 4, including in their plan is 988 implementation. So again, I think we see next session as really moving forward on the next step. And so your feedback right now is critical. I think the legislatures continue to be tied in. I also wanted to say, I'm just so proud of our state, and it was great hearing Rochelle present on the Native and Strong line. And for me, that's a key part of our system, and it's funded by the fee. Again, this fee is an ongoing, stable source of funding, and clearly we'll be making decisions on that fee next year. So great work, everybody. Continue to weigh in. We got a lot of work ahead, but it's a great team effort. Thanks.
Wonderful. Thank you so much, Representative Orwell. Betsy is just going to walk you through the format of the report, particularly for our community members who may not have had a chance to look at it yet. And then I'll set you up with some questions that I'm going to ask you in the discussion. Before we do that, Senator Dinkra.
I'm so sorry, Jamie.
No, it's fine.
I just wanted to acknowledge that Senator Judy Warnick is present here, and she has been such a good partner in the Senate on working on behavioral health issues. And I don't know if she's interested in saying something, but I would love to just take that opportunity to invite her to share a few words. And I apologize for going off agenda.
No, it's wonderful, and I appreciate you calling that out. Senator Warnick.
No, thanks. Senator Dinkra, I'm sorry you feel so bad today, but I think everything's been said, and I'm very, very proud of the work that all you folks are doing. So look forward to seeing the end results. So thank you very much. Thanks, Senator.
Thank you, Senator Warnick. And while we are there, I also see that Representative Dent is here. And Representative Dent, I don't want to put you on the spot, but I do want to offer the floor if you have anything you'd like to add to what's been said.
Well, thank you. I appreciate that. I don't really have anything to add either. I was just, excuse me, working on a text here to send to my colleague, Representative Orwell. I do have some things that I wanted to discuss, but I'm still. I like the overall plan that we have going. I'm still concerned about agriculture and being able to address the specific needs inherent in our agriculture workers. And I'm talking from our farm workers to our producers, everyone that lives in an agriculture environment. And I am still concerned, and the hours that I've spent talking to many people, I hear the same concerns from the community. So anyway, I just hopeful that through the next few months we can find maybe some solutions to the ag issue. Because I just I don't know if I think I've mentioned it before, but my grandfather allegedly, it was ruled a suicide in 1924. So it's 98 years later, the family still suffers. Those the ones that didn't work through it still suffer. So suicide is something that is kind of an ongoing gift, right? It never quits giving until people work it out. So I think it's something that we're doing good things here. We need to find, but hopefully we can find direction here to save a few more lives. So that's my hope. So anyway, I appreciate you calling on me. I'm just I have my camera off because I'm trying to catch up with some work, and I didn't want to be rude because it seems like I'm always behind. But anyway, thank you, and I am paying attention. So you caught me there, so I was listening. Thank you, Jamie.
I appreciate that. I'm sorry. I definitely didn't want to put you on the spot there, but I also didn't want to miss the chance to hear from you. And
I'm used to being put on the spot, so it's okay.
That's true. Your job. I think that's part of your job, huh?
Yeah.
And I am going to repost that message from Robert Small about the Seattle Times discussion on mental health next week.
Yeah.
Featuring Representative Dent, because you're absolutely right that that's a really important issue. So I'll put that up there. In the meantime, I'm now going to turn it over to Betsy to walk us through the format, and then I'll come back, set you up with the discussion questions, and then we're going to start hearing from the CRIS. So Brittany, if you don't mind putting up slide 10, Betsy's going to walk us through that.
Thanks, Jamie. Good afternoon, everyone. Betsy Jones, Health Management Associates. Just very briefly, for those who have not read the report, to ground yourselves in the discussion. This is the outline of the report, which is a progress report due to the legislature in January. We have a table of contents, and then we go into the background of this work and the legislation and what it tells us to do. And then section 3 is really focused on the 8 areas that the legislation tells us to focus on, and gives progress reports, progress updates in each of those 8 areas, including what we know currently, and committee and tribal partner input around known gaps and areas for recommendations in those 8 areas. So we've interwoven what has happened through the committees, the many, many committee meetings that we've had, and comments, feedback, recommendations that have come through. Section 3 is focused on funding recommendations related to the 988 line tax and specific to the line tax only for this year. Recommendations relating to overall behavioral health crisis system funding will be addressed in 2023. Section 4 focuses on what we need to explore in 2023, including system goals and metrics, crisis system services needed to meet these goals, funding and equitable distribution of services, and system infrastructure. And I like to say that this year was really table setting for us to dig deep into where we're trying to go and what we see as necessary to get us there in 2023. So this will be a big roll up our sleeves year, and we're currently planning for that. Jamie, I'll turn it back to you.
Thank you, Betsy. Brittany, if you could just jump to the next slide, I'll walk everyone through the discussion questions. And actually, before that, I'll say, you should be aware that Thursday we are having our steering committee meeting. The steering committee is going to be spending the bulk of that time discussing CRIS committee feedback from today, and then providing direction on next steps to revise and finalize this report. So that's what's going to be happening with the feedback you're providing today on the report. You may be having some feedback that also overlaps with our discussion later in this meeting today, where we're talking about the work of the year overall and gathering your reflections on that. So I'm going to, as a facilitator, kind of steer us toward focusing primarily on the report in this part of the conversation. If there are pieces of feedback or discussion points that come up that are more related to that bigger question or other question about reflecting on the past year, I might put a pin in that for our conversation later. So here are the questions we're going to cover in this discussion. I'll probably take the first two questions together, and then we'll dive into the third question after we've discussed 1 and 2. So first question is, does this report reflect the feedback you have provided this year on the vision, recommendations for promoting equity in crisis response services, and known gaps in areas for recommendations across the current crisis response system? And if not, what is missing? And then the third question we'll cover is, what are your thoughts on how we share this report and use it to educate and engage decision makers and community members in 2023? Now, just to remind everyone, this discussion is for CRIS committee members only. So I'm going to ask that if as many CRIS committee members, if you can put your video cameras on, that'll make it easier for us to facilitate a conversation together. Community members, if you could turn your video cameras off, that would be great. Let's stop the share, but Brittany or Nicola, if you don't mind copying and pasting those questions in the chat, I think that would be really helpful for our committee members. So let's start with that first question, those first two questions. Does this report reflect, based on your reading of it, reflect the feedback that you've provided this year on a few topics? So specifically the vision, recommendations for promoting equity, and known gaps in areas for recommendations? And then if not, what is missing? And please raise your hand or send me a chat if you have anything to offer here. Thank you, Brittany. So Brittany's just posted the questions, or is posting the questions in the chat. I appreciate that.
I think that the report is great, and I had to put some time reviewing it. I will say it again. When we talk about equity, if the lens of equity doesn't mean a report reflecting diversity, who is acting in the crisis line, what efforts are being towards that, what's the demographics, how a land of ethnicity looks like, assessing our crisis line. I keep bugging you all with that, but I think we're missing a point. We should address somehow who is accessing, who is really calling the crisis line. What the information was given today about interpretive services, just the beginning. So maybe something like that. I think for me, who are here representing service to underserved population, it feels like something is missing when I read it from that perspective.
So thank you, Claudia. I just want to probe a little bit more to make sure I'm understanding. So if I'm hearing you correctly, it sounds like you're feeling like we need to go deeper on the demographic data about who is accessing the 988 line and who's using these services.
And even if it's not very deep, because this is our first year,
Sure.
just call out the efforts. We are looking at, like today was shared about the different vendors were being used. We're going to be looking more into that, something that kind of creates a framework for people of color saying, oh, okay, this is something that is for us too. So I would just say, even if it's an introduction.
Okay, thank you, Claudia. And I see that your comment is being echoed by Puck, who says, I strongly agree. I would like to see more effort toward data collection so that we can recognize who's underserved. So thank you for that. And just to remind everyone, if you could use the raise your hand function, if you want to contribute, that'll help me make sure we're not talking over each other. Representative Dent.
Thank you. Appreciate that. So I'm not sure I totally understood the previous speaker, her point. I was trying to get it, but what I'm concerned with that we're taking in the difference in cultures, and we all live in a culture of some kind, right? Every single one of us, every picture on my screen right now, there's 25 pictures and there's probably 30 cultures, right? I mean, that's just the way our lives are. And I think to understand what it's going to take, my biggest concern has always been, what is it going to take to get that person who's in this crisis to pick up that telephone, and what do they need to hear on the other end? Okay, and that's the part that I'm concerned with. And are we addressing that completely? And if we are, that's great. But I'm concerned we're not. So just so you know, that's something that I've thought about and I continue to think about, and I probably will always think about. I'll probably always be pounding this drum forever, but until maybe we get it right. But we're all we're different. All of us are different, and that's good. It's good that we're like that. But just something I guess I just wanted to bring that up so we could think about it a little bit. Thank you.
Representative Dent, you mentioned that you hadn't been able to hear everything that Claudia was saying, and she was talking about doing deeper data collection in the coming years so that we can really understand who's using the line. And I think that nicely links with what you just said about how everyone's different. And if I'm hearing you correctly, it may take different messages or different strategies or different ways to get a different person to pick up the phone and make that call. And you would like to see more of that in the report.
I would.
Okay, great. Thank you so much. I see Michael Robertson, followed by Joan, followed by Kim. Michael. Michael, you might be on mute here. Oh, okay. We'll come back to Michael. I think he might have had a technical difficulty there. So Joan, then Kimberly, and then Dylan. Joan.
Thanks, Jamie. So a couple things. I think the discussion on the vision statement accurately reflects the feedback we gave. I think the section on equity was really helpful, sort of laying a foundation for the work ahead. I would echo the comments about needing some more data in the report. I think I was a little concerned that a lot of this data seemed to be pulled from a survey for which there was only a 35% response rate. So I'm not sure how accurate of a picture we're getting with that. The section about the number of beds was a little bit confusing. There was a list of beds on page 36 that there was 182 crisis stabilization units. The following page had a discussion about beds that Commerce has been funded. I couldn't tell if those were new beds that were coming online in the future, if they were in addition to the 182, or if they were inclusive of that number. So I was confused about how many beds we really have. Similarly with the mobile crisis teams, it was stated many times there's 53 adult teams in the state, 10 for youth. But I'm struggling to understand what exactly that means in terms of building out our crisis response system. I feel like we're missing a baseline. How do we know what number of mobile crisis teams each county or region needs? I didn't sort of have a perspective for whether or not is 53 teams, are we close to having enough based on the population in our state and region, or are we still really far off? I felt like I was missing a little bit of context there. What else? I appreciate the recommendation to maintain the telecom tax. I think that was really important. I think that really helped us get the launch for 988 off to a really great start. And then just sort of the last thing, these are sort of, comments that jumped out to me the first time I read the report. I wish we had a little bit more time with it to digest it. I'm sort of going to be scrambling to write something up by tomorrow. But I do appreciate Senator Dinger's comments earlier about how we'll have plenty of time this session to continue commenting on these recommendations and the legislation that comes out of it. It was a lengthy report for us to digest in a short amount of time. So I hope these initial comments are somewhat helpful despite that. Thank you.
Thank you so much, Joan. So just a quick summary, then I hear you echoing the previous comments from Claudia Puck and Representative Dent about going deeper on the data. You mentioned there were a couple of areas specifically like around the bed numbers, bed counts, for example, where it would be really helpful to clarify what those mean. And I heard you talking about connecting the dots a little bit more for us on what some of these numbers mean in practice and in addressing needs. So, and then finally echoing comments from our November meeting about doing whatever we can to provide a little more time for the CRIS Committee to review future reports. So thank you for the thorough comments. And thank you also for, it sounds like you're planning on turning in written ones tomorrow. And I know that will make it a lot easier to make sure all these are incorporated. So appreciate that. Kimberly, followed by Dylan, followed by Ron. Kimberly.
Great, thank you. Hey, Jamie. Hello, CRIS members. Appreciate the opportunity to weigh in on this report. Certainly very comprehensive and very commendable in that this report was trying to integrate so many different views and interests and really get principle on the table as well as practice. But I think where I'm concerned is the lack of depth as well, particularly in the services area of the report, at least in the areas that I'm familiar with as somebody that works with co-response teams and at the city of Poulsbo. My world is with emergency crisis response. That is emergency systems responding to crisis through 911, through police, through fire, through EMS, through hospital emergency departments. And while I think that the report certainly reflects some feedback that I gave earlier in this process about the importance of including emergency systems, it just doesn't go far enough. There's just so much here that's not included. I'll just flag a few things and I'll be happy to follow up with some written comments. Would have liked to have seen something, anything about the role of fire EMS in crisis response. There are so many promising practices that are being experimented with in Washington state that have no mention in this report that I think could really benefit from our flagging. I certainly would have liked to see more here about how 911 handles crisis calls and the enormous potential for 911 to be sending calls over to 988, what standards would look like for those sorts of transfers, what kind of staffing might be necessary and training for that to happen. My bias is in the area of co-response. I do a lot of work with co-response units throughout the state. I very much thank the authors of this report for putting co-response in the report, but the data here is very outdated and incomplete. Washington legislature funded a study at the UW to do an in-depth analysis of co-response teams to understand how many they are, what they're doing, where they're effective, where they're falling short. Would have loved to have seen some of the preliminary data from the UW showing, for example, there's over 65 teams in the state, and many of them are doing non-crisis related work, much more connected with follow-up and preventative work than crisis response. So just to summarize my comments, great start. Again, I really appreciate how many interests are expressed here and the focus on vision, but I'd love to see more of a drilling down into the actual services in the field, particularly around emergency response. And frankly, I'd like to see a subgroup form of people on the CRIS that are working in emergency crisis response to just provide some more detailed feedback, maybe some better data, and even anecdotal reports about how the emergency system functions, and certainly could be improved. Thank you very much.
Thank you, Kimberly. And you did a nice job facilitating there, summarizing your comments at the end. So I'll just do just a quick summary, which is I heard a desire to see more depth in the service areas, particularly around co-response and the role of first responders. Thank you for that. And we'll be looking forward to seeing your written comments. Dylan and then Ron. Dylan?
Hello.
Oh, yeah.
Hi.
Hi.
Yeah, so but just circling back also to that equity piece, and I was also looking at the technology. I know that just through my organization as a community mental health provider, we are going through the pains of doing our technology integrations and working with our client populations to make sure that they also have the tools to be able to access the services here. So we're investing quite a bit into making sure we have the technology, and I do see the state and other public benefits putting out like, free phones or lower cost options out there. But we already know that technology and data and internet access is not the same across the board. And so I would like to continue to see more of that growth there. And that might not be within the scope of what 988 and CRIS is necessarily doing, but it is something that lower income individuals, actually, they might be using not from one of the big three or one of the big five mobile providers, for example. They might be using a prepaid plan. And for some of you might not know, they actually get deprioritized as for their everyday types of calls. I know that emergency services has a different level of priority when it comes to pushing through calls. But the working with just a sense of like restriction, in a sense where you're trying to ration your minutes or your data, it changes the way people sort of interact with systems. So that's just something that I know I've been thinking a lot about as we look through trying to make our services more accessible to folks as in this sort of hybrid working world.
Thank you, Dylan. And I do want to draw a distinction here too, because I think Dylan's point and some of the points about data are really important. It sounds like doing in the coming year, if it's possible, to do a deeper dive into technology and some of the technology on the user end that needs to be addressed. In terms of the current report, I'm not sure how much that factors in here, but I think that that's going to be a really important comment for us to revisit when we have our conversation later about 2023. Again, I don't have the expertise to say what data was available for this report, but I'm hearing a lot of interest in having deeper dive into data. So we should definitely talk about that when we're talking about 2023. So let's see, I see Ron and then Kashi and then Jen. Ron.
Thank you. My name is Ron Harding. I represent the Washington Association of Sheriffs and Police Chiefs. I'm the Chief of Police for the city of Paulsbo. And I just wanted to highlight one concern that I think is represented throughout the document that is kind of an undercurrent or a tone that, in my opinion, could present kind of a false premise or a false promise. And that is that law enforcement will not be associated with 988, and that 988 calls would not eventually, or in some instances, result in also a 911 police or emergency response. Because I don't think that we can make that promise, because the conditions surrounding 988 calls, as you know, most of the time probably would not need any law enforcement response, but those situations can degrade and the safety concern can become necessary and immediate. So I think we just have to be careful not to say that law enforcement will be completely separated from this system, and that calling 988 would not result in the potential of law enforcement or first responder response. We don't know what circumstances might devolve into. So that's just something I wanted to highlight. I'll flesh that out more in my written comments, but wanted to make that apparent just up front. Thank you.
Thank you, Ron. So it sounds like you were seeing maybe an undertone that suggested that law enforcement wouldn't be involved in some of these calls. And I actually just sent a quick message to Betsy to see if there's anything more we need to discuss there, but I really appreciate you raising that. Before I call on Kashi, community members, I'm getting a few chats from you, and I will do my very best to respond to those at the break. Right now, I need to really focus on what CRIS committee members are saying, so I'm not able to read your chats very thoroughly right now, but I will come back to them at the break and respond to as many as I can. Up next is Kashi, followed by Jen. Kashi.
Thank you. Kashi Arora, she, her pronouns. I'm the Mental and Behavioral Health Program Manager at Seattle Children's, and I represent the Children Youth Behavioral Health Work Group on this group. So my comments are always about kids, and I did appreciate how many references to the youth system are in here. I think that the current state section specifically, and I will own that I'm not all the way through this report, it's 98 pages, and that takes a while to get through. So I just wanted to flag that in the current state section, I do think there's some room for improvement on differentiating the ways in which when we describe current state, I think there's an assumption that some of those services are available to the entire age continuum, and that's not the reality. So to go back to the point about 182 crisis stabilization units, I'm not aware of any of those that are available to kids or youth. And so that's just an adult specific resource. And I think it's really important as we look at the equity of funding the various systems that we understand who currently has access to what things that are in current state. The second thing I wanted to flag specific to the current services section is that a lot of the youth data sort of seems to end at spring 2021. There's some things that were pulled there from the governor's emergency declaration in March. There's some things pulled from hospitals in June of 21. But the last year and a half has continued to be unprecedented in terms of need and crisis. And so I'm concerned about a report in December 2022 that doesn't reflect what an incredibly challenging year this has been for children and youth, and the way that we have seen that is in the hospital system. Our emergency department is completely full, and our inpatient unit is struggling to meet the needs. And so I'm concerned about the sort of gap in data from when it was cited in the report and where we are currently. And then I will echo the concerns others have raised about wanting to see more data about the calls and who is calling. And I'm always going to advocate for an age breakdown so we can see who under 18 is calling and how they're supported. What are they triaged to? And then my last comment, will be about differentiating. I think Joan said this, and I wanted to echo this, that it's not clear to me if some of the things in this report in terms of a place to go or someone to respond in terms of mobile crisis response is ideal state or planned state or current state, because some of those teams, I'm under the impression they're not actually online for youth in all regions yet, but that there is funding for them to be in place in the coming years. But I think it would be good to clarify which are actually in place and which are planned to come online. And I will plan to put this in writing as well, but I know how much work it takes to put together a report. So thank you for taking our feedback.
Thanks so much, Kashi. So I heard a few things there that nicely linked to some of the other comments that folks said. So in particular, digging in enough on the data breakdown so that we're clear on what services are actually available to youth, since it sounds like quite a few of them are not. Excuse me, echoing the need for more deeper and more disaggregated data on demographics. And you raised a comment that I think anyone who's wrestling with data across the board is seeing, which is that over the last 2 years, some of the need has been unprecedented, and unfortunately, that's also impacted data collection. So, Kashi, I just want to clarify, if the better data is not necessarily available, it sounds like it would be important to say that so it's clear to the reader. Okay.
And part of the reason I say that specifically is that children's hospitals or hospitals in the state are cited specifically in this report, and it's information we all provided in the context of the governor's emergency proclamation in March of 2021. And I think that many of us would be willing to provide a similar bullet point about what we have seen in the last year to 18 months, because it is worse than it was in March of 2021. And so that's what makes me concerned, is we're named specifically, Seattle Children's Sacred Heart is named, Swedish is named, and I would be interested in what the other hospital partners would say as well about what they've seen over the last year and some change.
So it would be possible to gather some updated anecdotal evidence, and I'm not going to speak for the team writing it. I imagine that could be tricky to accomplish by December 30th, but to Senator Dingra's point, there may be opportunity to bring more of that information in after the new year. So thank you for raising that, Kashi. Jen and Darcy and Michael and Justin, let's go with Jen.
Hi, thanks so much. My name is Jennifer Stuber and I'm at the University of Washington and my pronouns are she, her. I'm going to start by just echoing a couple of things I've already heard just briefly and then go into a few other points. On the youth data, I specifically wanted to see, we said there was actually a typo, I think, in the report around suicide rate not declining by 1% in 2021. I think it was trying to make a comparison between 2 years, but I thought that was a little bit misleading because I'm pretty sure, although I haven't seen the latest DOH data, and I'm sure it's been reported, but I really think we need to provide the picture around what's happening with youth, not just around emergency departments, but around youth deaths that have occurred, which I think they actually have gone the opposite direction from the overarching number. And I struggled also like with the reporting of crisis stabilization, mobile teams. I can definitely say that the co-response, universe was underreported. I just struggle with like, where's the transparency around these services currently? Like, where do we see it? Can we see it on a map? Can we learn something about these services as they exist? I almost had the impression that if I was a legislator looking at this report, that like, maybe we're doing fine. Like maybe we don't need more. And I look at those numbers there and I honestly just don't believe them in some cases, I don't believe them because there's no transparency. And I think that kind of brings me to the larger point that I feel like I make repeatedly, which is that who is leading the system? Who is the orchestra conductor of the system? We talk about our regional system. I know HCA and DOH are playing an enormous role and it's super important to implementation. But at the end of the day, like if we have a regional system, who is leading that? Who is bringing together 911 and 988? Who is making sure regionally that the players in the emergency crisis system and the current crisis system are actually, and the 988 and the 911 are all working together. And like, that's not going to happen at the HCA DOH level. It's going to happen regionally. We know these services are local. And yet I did a word search for ASO in this report, and I think I came up with like less than 10 times that word was actually used. And so it's odd that the orchestra conductor, who I think is the orchestra conductor of the regional crisis system, is not talked about, and their role is not talked about and fleshed out. And I think, it was interesting hearing Jane's comment, like right at the outset, she said, this is how it's going to go down. Like the ASOs are going to contract with the commercial plans. And I think that's the kind of conversation, I feel like a lot of what we're saying in this report isn't quite actionable yet because we don't actually know who's in charge or who's, and how are we going to get to the goals and the metrics that I really appreciated that part of the report. But again, who's in charge of that? Like, who's going to make sure that we have a transparent, accountable system? And if that's regional, what are the regions? Who is in charge? I guess my last piece is just around training. I feel like we don't have good information around what training is actually needed to make this system work better. And I think some of that is, again, goes to my last comment about who's in charge, what's the regional organization? Is that the ASO's role? Like, whose role is it to do training? But what training is needed for the diversity of players in the crisis system? I don't really feel like was captured very much in the report. Thank you for the opportunity to provide some input.
Thanks so much, Jen. So I heard a few things there. A big question that Jen has mentioned before about who and how this is all going to be knitted together, and seeing that Jen sees that as regional, and that use the metaphor of an orchestra conductor. So if that's the case, maybe that should be mentioned or clear in the report. It may also be that this is something we should be talking about in our conversation for 2023. So let's make sure we circle back on that. All right, let's see. I see a lot of hands here, so I want to make sure I get to other folks. Let's go with Darcy, and then Michael reading, and then Justin, and then Jen.
Great, thanks, Jamie. Darcy Jaffe here from the Washington State Hospital Association, and my pronouns are she and her. So just a couple of thoughts. I agree with what many of them have said regarding some of the data and the mobile outreach, giving the impression. I mean, when I looked at 53 adult mobile outreach teams, I'm like, well, that actually is quite a bit. But I do know that in particular, when I'm in rural areas and talking with rural ED providers, that most of the time they don't, when I said, you guys have a mobile outreach, the answer is no. So it would be helpful to have maybe a better understanding of where those resources are and how they're being used. The other thing that occurs to me as I was listening to particularly Kimberly and Ron, I know we had some of these comments in the first report about the not as much input from or reflection in the report of emergency responders. And it does make me think that at some point, maybe there's a conversation about, is crisis response and emergency response in behavioral health the same thing? Mm-hmm. And it may be that we have a mental model that doesn't actually include some of the more emergency type responses. And if that's the case, that should be reflected somewhere. And if it's not, then we need to call out more the role of first responders. When I look at the report, as Cassie talked about some of the information about the children's places to go, there's very little about the adult places to go in regard to emergency care. There's like there's a couple sentences about emergency room visits based on Medicaid data, so we know it's pretty underreported. It doesn't have, there's no recognition of the number of involuntary patients on single bed certs in our state that reflects, really a lack of a place to go for some of our really people that are in the emergency phase of their behavioral health condition. It doesn't talk about the lack of a place to go for older adults. So I really think we need some more data that looks at the population beyond just adults and kids. In general, there's just not enough places to go, but I think we do want to recognize that there are a lot of parts of this report that could be enriched to show a better picture of where we are current state. That's it for me. Thanks, Jamie.
Thanks, Darcy. And you said a few things that I forgot to call out from Jen's comment too. I hear some echoing there about how some of the data as presented might lead the reader to interpret it differently or incorrectly, imagining that maybe things aren't as bad or they're not understanding. This also goes with what Kashi was saying, not understanding that it could be just fine or better for one population, it's inadequate for another. So I appreciate you raising those and echoing that. And it sounds like maybe some of the direction in the revision is to connect the dots a little more and do a little interpreting of what the data means in terms of the current state. And I see an echo here in my chat from Kashi wanting to echo Darcy's comments. It would be wise to have a section on interpretation of the data. So thanks so much for that, Kashi. All right, I'm just going to do a quick time check. We have about 17 more minutes to keep talking about this. I'm going to try really hard to get to the question we had about how we use this report, but the priority is definitely getting your feedback and discussing it. And again, I hope as many committee members as possible can send written comments. Michael, and then Justin, and then Jan. Michael?
Yeah, thanks, Jamie. So my name is Michael Reddy, he, him pronouns. I'm with the King County ASO, and I'm here representing the Western States ASOs of Western Washington. I agree with a lot of the comments already noted. I'll try not to repeat those, but I do want to elaborate, especially what Joan was talking about with the data, and a few others mentioned, like, for example, 53 mobile crisis teams. It feels to me that the report's really focusing on a statewide vision, which I think is important and key, but I think it's also important to think about the regional perspective. So we'd say 53 teams across the state, like, well, what does that mean regionally? Because, half of those might be in King County, or one of them may be in King County. And accounting for the cultural needs across the regions. One thing I've learned from my ASO partners is the differences amongst us. Things are very different in rural areas than in urban areas. And King County actually has a mixture of types of areas. And so I feel like that's missing in the report. And I also want to say thank you for the report, because I think there's so much here that's rich and fluid, but also I think tells me that we still have a lot of work to do. And I know this is not the end result, it's a journey towards. So it also makes me wonder, what are we doing to project? Like what's our target? What are we striving for? If we're saying that we have 53 mobile teams across the state, does that mean we're halfway there, or are we there, or are we? We're not saying what the target is. I think that's a hard thing to try and pinpoint. But when we think about the vision of a place to call, someone to respond, a place to go, what are we trying to achieve? And I'm thinking that reading this report, because I know in King County, we've done a study of our crisis system to identify the gaps, and we slowly are missing the places to go. And so we're making a plan right now to build those places, even with local dollars. So trying to create that target. I don't feel like this is here, especially from a regional perspective. I think I appreciate Jen Stubert's comments on the orchestrators. I mean, as we know, the regions, the ASO regions are key to crisis systems, and we've had much conversations with trying to understand that the work that we do and having input. I want to continue to advocate that we can continue to have more input in terms of how this is orchestrated when we're thinking about the services within each region, but thinking about the differences amongst the regions as well. So thank you.
Bipasha, I just did it too. I just started talking with my mute on, so I do this too. Thank you, Michael. I appreciate it. And I do want to acknowledge that there is a lot of consistency across the comments. And some of this may be showing up in the what we want to accomplish in 2023 section of the report. For example, if some of the depth and data that we're hearing so many CRIS members say is really essential, or to Michael's point, measures and targets that allow us to interpret the data and be able to say, hey, are we close? Are we miles away from where we need to be? So just want to acknowledge that again. I am not the report author, so I can't speak specifically to what aspects of your feedback might change the body of the report or be focused on next steps for 2023. But I do want to acknowledge that all this feedback is important and we will be incorporating it into the report. Let's go with Justin and then Jan.
Thank you, Jamie. Justin Johnson, I am with Spokane BH ASO representing rural communities and the ASOs. We appreciate everyone's time today and really appreciate all the feedback that's given. And I want to shout out to HMA and the authors of the report, 98 pages of hard work. So with all the feedback that's given here today, I want to clarify so much great work has been given out to produce a report. So I want to make that clear. Right before I jump in and talk about where I'd like to add some points in there. So really want to state that thank you for your hard work and really consolidating a lot of what we shared over the last year here. I think echoing a lot of what has already been shared, so I won't reiterate that. There has been and recognize a lot of work still needs to be done. And from a rural perspective, there's a lot of acknowledgement of the needs that exist and the needs to be responsive, but not of a coordinated effort to address those, especially in light of, and I'm speaking on behalf of Eastern Washington, the loss of a lot of new facilities and existing facilities that support stabilization services, interim care, and then the reality that none exists. So Eastern Washington, we don't have a secure withdrawal management facility. We have SWIMS units, but not a secure withdrawal management. We don't have youth facilities for withdrawal management or even specialized stabilization or ENT. And the recognition that this report looks to address that those need to be there, but not a uniform approach. How do we get there, right? And the reality that those need to be in existence if we are to go along that continuum. And the only inpatient service that we have available for youth under the age of 10 is in Idaho, in Eastern Washington. I mean, that's just, so I think that is a reality of the report, is just functionally recognizes there is a lack there, and how do we get to that point? And then the second point is both echoing what Jen and others have said, you know, what do we coordinate within the existing network those who are doing the necessary services, and how do we connect all the partners together. And I don't know if the report really does a great job of saying how that communication across all those members in the existing sense works together and then builds upon that. It has a lofty goal in terms of what we want to achieve, but how do we use that with the existing one, recognizing that work is being done. It may not be the most ideal. It is currently being done to reach those in those communities. So how do we branch on that with law enforcement, with ASOs, with first responders, with the managed care organizations, and even with those on the commercial insurance side? So I think really a uniform approach in working and connecting all those is something that I found was alluded to quite a bit in the report, but is something that could be much more specified in terms of how do we make that in a practical sense. And so those are just the points I'd like to make, and really appreciate everyone's time today.
So Justin, I just want to make sure that I am tracking. So Jen Stuber had mentioned the importance of figuring out and being clear about who's knitting all this together, who's bringing it all together. And you're saying in the current state description in the report, it would be there. Some of this is being done. It may not be beautiful or where we want it to be, but it would be important to say what's happening now with respect to bringing it all together and communicating across partners. Am I tracking there correctly?
Right. Really just saying de facto, we have individuals who are taking point on that. Let's acknowledge that, and let's build on that if that's what we want to do. Because building a system from scratch, whereas improving on a system that exists, and this is the improvement committee, is really what we should be acknowledging. I think that's the 2 cents I'd like to add.
Okay, so if our approach is going to be to build on what we have, we want to just make sure it's really clear what we have. Okay, great. Thank you so much, Justin. Let's take Jan, and then I'm hoping we can spend the last few minutes on that third question about how we use this report. Jan, thanks for your patience.
Thanks, Jamie. First of all, I really appreciate the work that was done with this report. I read it at least a couple times, and every time I read it, there was something new that I picked up. And it was a lot to digest in a short amount of time. And I wish that we had more time to really take a look at this and then respond accordingly in writing to you. One of the things that is unique about Frontier Behavioral Health is that we are the 988 hub for Eastern Washington, but we also have mobile crisis response teams. So when I read this report, I was reading it from a few different perspectives. And the one thing that's that I was struck by was that there are a lot of great ideas, a lot of great comments, but I'm not sure how it's going to be actualized. I don't know what these comments mean and what it entails in order to satisfy meeting whatever the recommendations are. The one thing that I really did appreciate was the references to workforce. It is awesome that we have all, this funding and these new mobile teams and these new facilities, but I really appreciated the fact that workforce was a consistent theme, because I think we're all struggling with that. It's great to have these resources available, but without the staff, I don't know how we're going to make this all happen. So I wanted to call that out because I felt that that was a theme and that attention was being given to that. And I hope that that is something that is at the forefront. I also echo what Justin says. I am a proponent of enhancing resources that we have rather than creating brand new resources and trying not to duplicate existing resources. Thank you.
Thank you, Jan. So it sounds like a few of you are still trying to understand what that path is from here to there. The feedback I think relevant to this report is maybe some more acknowledgement that that's still something to come. And then you also echoed Justin's comments previously. So thank you for that, Jen. I'm going to quickly take Bipasha, and then I want to circle back on our last question about what to do with this report. Bipasha.
I just real quick wanted to say I have not read the full report, but I did do a word search. And nowhere in the report was I'm not criticizing, but it's important that 211 was never mentioned, even under an example of interoperability. And I know this report is about mental health and crisis mental health and behavioral health issues, but as a person who answers calls on the crisis line, I cannot tell you how many calls are about, I need help for paying my bills, I need help for rent, I need shelter. And as we all know, housing is mental health care. So somewhere, if we can please mention agencies that provide, very basic needs that are important. And the other thing I felt is that the section that talked about postvention and agencies that provide that, I think of as the crisis call hubs to be part of that system, because I know, again, I don't speak for the crisis call hubs. I'm only saying this as a person who answers call, but we do tell our callers that if they need support, they cannot access their therapist or they're between therapists or looking for support, to please call us and talk to us if they're having a hard day. And I think that is part of the support system that holds communities together. So it'd be important to mention that crisis call hubs are part of the prevention and postvention process too. Thank you.
Thanks for that, Ipasha. So mentioning crisis call hubs and maybe any other services that provide a gateway for crisis response. I just want to add a comment from Puck in the chat that the enhancing current resources point that Jan and Justin had made, that aspect also has been coming up in equity conversations as well, in particular focusing on community-based services that exist. So thanks for sharing that, Puck. 4 minutes is probably not enough time to do a real conversation about what are our ideas for how we use this report to educate and engage decision makers. I don't want to short shrift this conversation, but I also want to make sure we're really preserving time for our discussion about setting the table for 2023 and reflecting on 2022. So I'm going to ask folks to maybe do some quick homework, which is, and I know you've already got a lot of homework on your plate, so please forgive me. Priority is getting your written comments on the report. But if you also have ideas to share about how this might be distributed or shared, that actually, we can take those into the new year too, because as Senator Dinkra said, that's just, this is just, I think you said this is just the first lap. So we've got more laps to run, and it would be great to hear your ideas, and also maybe how you or your constituents or colleagues might be able to use this report or distill it to educate and engage decision makers. So I think that we might do that in lieu of having a robust discussion on that particular topic. That does leave me 3 minutes to get Jane. Welcome back, Jane. Thank you so much to get Jane's input. And then I'm going to give you a short break, and then we'll come back and do breakouts. Jane.
Okay, so Jamie, I'm always a pain in the neck, so I'm not going to go along with your direction to send something in writing. But on the question of how to use the report. But when I look at the legislative requirements, first of all, I think, number one, thank you so much for Nicola and all the work that went into putting this report together and for all of the really thoughtful comments. But as I step back and I listen to it, I'm reminded, number one, of what is supposed to be in this report, right? That the January 1, 2023 report is almost like, here's a baseline, and here are recommendations about how to funding crisis response services, which, and Senator Dinkra, Representative Orwell, I don't want to say anything that's going to offend you, but it's hard to come up with recommendations about what and how to fund before you know exactly what it is you're funding. So, and I think almost all of the questions that were raised by folks today are exactly about what the work of CRIS is in 23 around, how do we do these things? So it sets it up. And just in terms of how to use the report with folks, I think characterize it as this is a baseline. This is, and with all of the input that was put in about what can be done to enhance describing what the baseline is, and then clearly stating that this is the baseline, this is what's there. It doesn't mean it's everything that's needed. So just really be super clear on, I hate to use the word messaging, but the messaging on that, and then super clear about what comes next and what the work of the CRIS is, so that this isn't characterized as a report that about what the system should be, other than the vision, which is really important, or this is not characterized as a report about how we get there exactly. It's a baseline that we work from that can help inform not just the work of CRIS, but legislative issues that might come up during the upcoming session. So those are thoughts. Hopefully they're helpful.
They are, Jane. You characterize yourself as a pain in the butt, but I always find your remarks really, really helpful, and I appreciate you synthesizing all of that. It sounds like the takeaway is to make this particularly used and useful, and to Senator Dingra's point early on, that some legislators may not get through every word in this report. It's going to be really important to be very explicit about what this report is and what it isn't. And as we're using it out in the community, we also need to be very explicit about what it is and what isn't, and use all of the great feedback that we heard today from CRIS committee members to really jumpstart what we accomplish in 2023, because it sounds like there's a lot to do still. We're going to actually dive into that discussion. I kind of can't believe we're right on time here. So it's a lot more discussion with CRIS today, which is wonderful. It's what we've been aspiring to get to. So I'm going to give you a 10-minute break. We're going to come back at 3:50. So please have CRIS committee members have your cameras on at 3:50. We are going to go into breakouts. Committee members will be staying in the main room. I'll give you all instructions when we come back. Enjoy your break. See you at 3:50. Welcome back. Give folks another minute here. Okay, so the second half of our meeting, we're going to do a dive into setting the table for 2023 and reflecting on 2022. And originally we were going to kick this off with some, excuse me, my throat decided to get really tickly right when it was time to talk again. Originally we were going to start with some reflections from Senator Dinkra about the work this past year. Unfortunately, she is really not feeling well, poor thing, so she's had to jump off. But for those of you who were able to attend the CRIS Committee meeting in November, I think she shared a lot at that meeting about reflections on sorry. Okay. Excuse me. I had a chat come up that distracted me there. I apologize. She shared a lot of reflections about 2023 and the importance of the work that's been done to date. And I've heard a few comments along those lines today. So I think we're good to move forward without that context, and I'll wish her well, and hopefully she'll feel better in a couple of days or less. So we're going to break into 4 facilitated groups today, just as we've done in the past. And the facilitators today are Suzanne, so you've seen Suzanne before, and Liz, and Michael Anderson Nathy, and Megan Celadonia. So Megan, thanks for jumping into the facilitation team with us. So we're going to send you into breakouts to discuss 3 questions. Community members, I'm hoping you'll stay in the main room with me and have a similar conversation here. We'll come back in 20 minutes and we'll do some sharing out and processing and discussing what we've heard. And then again, the last 10 minutes, we're going to be Senator Dinkra kind of reflecting back what she's heard from you and how that might influence their thinking and everyone's thinking as we go into the new year. So I might ask other steering committee members. This is oh, sorry, it looks like Laura Collins will be doing the facilitation instead of Liz for room 2. So I might ask steering committee members if you could be listening in these group discussions and maybe be prepared to share a few reflections at the end about what you've heard and how that might influence your thinking going into 2023. I think we can pick up the baton from where Senator Dinkra might have carried it. So Brittany, do you mind putting the discussion questions on the screen? I just want to give everyone a heads up about what we're going to be talking about. All right, so my question for CRIS Committee members first is, how do you hope to contribute to this work in 2023? There's so much to do, as we gathered from our last discussion, and each of you brings so much to this table. So based on what you've heard in our previous discussion, what you've been thinking about, and the work that we've done this year, and what you read in the report, how do you hope to contribute to this work in 2023? Based on what you read in the report, what accomplishments or outcomes stood out for you? And then, and this is kind of circling back to the conversation we just had, what still needs to be addressed? And you can decide in your rooms with your facilitator if you want to address those questions holistically or one by one. At any case, we're going to be spending about 20 minutes on that. That said, facilitators, if you feel like you need a little more time in your room, please don't hesitate to, I think you can send a message out to a co-host and let us know if you need a little more time, and we can see if we can build a little more time for discussion. All right, so with that, I'm going to ask Brittany to stop the share and send our CRIS Committee members into their breakout rooms. And community members, you can stay in here with me. We'll have the same conversation here. Oh, and a reminder, facilitators, please record your breakout rooms. Hopefully they heard that before they all left. Okay. So community members, if you are feeling like you'd like to join in this conversation today, I'd love to hear from you. If you don't mind turning on your video camera, if it's available to you. I'd love to it might be a little harder for you to answer the question about how you hope to contribute to this work in 2023, but many of you are, I know, serving on subcommittees and otherwise really engaged in advocacy in other areas. So let's have that conversation. And if you had a chance to read the report, I'd love to hear your feedback on, based on what you were in the report, what accomplishments or outcomes stood out for you and what still needs to be addressed. And Brittany, I don't know if you don't mind putting those questions in the chat for everyone, just like you did with the last discussion, that would be great. Everyone, just a reminder, if you have any answers to those questions, if you can click on the reactions button at the bottom of your screen and then click raise your hand, I'll call on you in the order I see your hand up. You're also welcome to send me a chat if it's your preference to write your answer rather than say it out loud. Okay, I do have a question here that maybe Nicola or Betsy can answer, which is, how can I get a copy of the draft report? So Nicola or Betsy, when will a report be available for community members to read? And will that be posted to the HCA website? That's a question for you. Community members, how do you hope to contribute to this work in 2023? What accomplishments for 2022 stood out for you? And what still needs to be addressed? Any thoughts? You can take a few minutes to think about it. Laura, nice to see you.
You as well. I feel like saying Happy New Year.
We're getting close, I know.
I know, that's funny. I actually just would love to see a little bit more involvement from more of a diverse lived experience community. Some of the rooms that I've been in where 988 has come up, including some of the organized sessions through DOH and so forth, are pretty white. And I'm a little concerned about that. So I just want to put that out there as a way for us to consciously look at how to just bring a more diverse audience, because I think our input is going to be different by doing that, more enhanced by doing that.
That's a really great point, and maybe we can all do some thinking too about tactically how to go about doing that. So thank you for raising that, Laura.
And include family members as well in the comments that I've made.
Okay, so more diverse people with lived experience and family members. Wonderful.
Exactly.
Okay, thank you. I'm going to call on Joe, and then I see a couple of chats here I want to share. Joe.
Thanks, Jamie. This report is such an important blueprint for going forward. And I hope all of us are engaged, because you can't drive change of this magnitude just from Olympia. So when we get into the weeds of protocols and things of that nature, I think we all have to be involved. But one example is that we decided we want to know how our crisis system in North Sound is experienced by all the different populations. So we have contracted with a consultant, Pat Morris, to conduct focus groups throughout the region with different populations to find out how do they actually experience. I think we all recognize there's a lack of the data that we want. I think we're going to have to think creatively, because I don't think our normal means of collecting data will kind of get at what we want to know. So I think we're going to have to figure out a way to talk to the populations that we want to serve.
Joe, I really appreciate your comment, especially in light of how many people how many CRIS committee members earlier on had mentioned really wanting more data. And your point about how we go about collecting it is a great one. So thank you so much for raising that. I want to pause for a moment because I have some great comments from other community members. I hear from Kristen Wells, I hope to continue serving on the Lived Experience Subcommittee. I would also like to find a way to leverage my experience as a provider working in the current mental health crisis system. And that's wonderful, Kristen. I think very much fits with Joe's call to action that all of us get involved in the next year. So thank you for that. Jenny's answer to number 3, need more current data and mapping locations of gaps in crisis and behavioral health services. Yes, I think that, Jenny, I think we heard that a lot from CRIS committee members. We've heard that a lot in subcommittees, so thank you for raising that. And then another comment from Chris, I haven't been able to read the report, but I really want to start seeing and hearing about concrete steps that can start shifting the crisis system toward our vision. So I think everyone, it sounds like, is ready to move from here's our baseline to here's how we're going to get where we want to go. So thank you for raising that. Other thoughts either on how you want to contribute in the coming year, what accomplishments stood out for you when you, I know you didn't get a chance to read the report, but maybe what you've heard or what you've seen this past year and what still needs to be addressed. Mary.
Thank you. I think that access is really what it's all about for crisis. And we're hearing from a number of families who just are confused. Am I supposed to call 988? Am I supposed to call the local crisis line? Sometimes they call and they're not put through to our youth mobile crisis team. And, some families are saying it took me 4 times before I got put through, or I was put on hold, and I have no idea whether this was Crisis Connections or, which line it was. I was put on hold for 40 minutes, so I gave up. I'm wondering if there's a way for us to build in a fairly immediate survey, the kind you get when you go to the doctor and 3 days later you get a survey on your phone. And I know many people wouldn't respond to it, but I think a number of the people served would. And I worry that while we're putting this together, we could have some things slip through the cracks and not know that they're slipping through the cracks. And I think the overall plan when we get finished is going to be great. But I think things got a little bit rushed because, there was a bill passed and we were needing to sort of get ahead of that as a state. So I'm not really sure how we could have avoided having some little bumps along the way, because every system change has that. But I do think if we could start to get fairly soon, when, as soon as we can, some feedback right away from people who are involved with the system, the crisis system, experiencing the crisis system, it might be helpful. We're also kind of concerned that sometimes either the crisis line or 988, I'm not sure which, might be trying to resolve things by phone that really should be going to a mobile crisis team. Because, they want to help. They want to cut back on the number of calls that go through, but some of the situations are really serious and, we don't get pulled in right away. And I think that, I think we should more than we are. So the data that I heard was something like 25% of the calls that come in end up going to a mobile crisis team. And I don't know if that's accurate, but if it is, that's very concerning. And our referral numbers are way down since this was implemented. So I'm just worried about something happening during this transition. And again, I haven't read the report. I'll look forward to reading it. And I'm very impressed with all the committee has accomplished. It's amazing how quickly it's gone. And so it's in no way a criticism. I think every system change, we have to watch for the unintended consequences.
Absolutely. Thank you for raising that point that you're observing some things that are considerations or might be alarming you with respect to, are we appropriately handing off people to mobile crisis response when it's too serious to be addressed?
Right.
Yeah.
Teams. We have the youth mobile crisis teams for Pierce County, Clark County, and Thurston County. So, but we're kind of seeing some confusion in all 3 counties.
Yes, and I appreciate your comment too about maybe tactically there might be some way of collecting data from a user perspective so that we're understanding how people are experiencing this, especially when, sometimes when you have more choices, that just creates more confusion. So
yeah, I think there is just a lot of confusion. And again, it's new. So
yes.
That's it. But thank you for all your work on this, Jamie, you and the committee members and legislators, everybody. It's pretty been pulled together in a very short time. So
thank you for that, Mary, and a big shout out. Someone else said this earlier, but Nicola was the principal author of the report, and that was a heroic lift. So thank you to Nicola too. I'm going to pause for a second and just mention there's a comment in here from Jenny, and then I'll come to Beth. So Jenny said, we need to, another answer to number 3, need to drill down on services needed for special populations, for example, what's available and gaps. For example, services needed for persons with IDD. And I'm so sorry, I'm not sure what that acronym is. Does anyone help me? Can anyone help me out with IDD?
Developmental issues.
Okay, thank you.
Yes.
Mary, did you have something to add? I might have.
No, sorry.
Okay.
I always forget to take my hand down.
No problem. I can do it for you too if you need it. Beth, did you still want to share something?
Sure. I just wanted to share a moment of gratitude for the feedback from everyone from CRIS and the feedback in this group, that it really helps me appreciate the purpose of these meetings. And the purpose of the CRIS is that, everyone here has expertise in different areas, right? It works in these different areas, many of whom are directly serving our communities. And so, I just really love hearing from the people doing the work and from the people doing the work with our communities and serving the people that we are wanting to serve through the work that we're doing here, and just wanted to share that gratitude. So thank you all.
I echo that, Beth. I really appreciate so many community members who've come to so many of the CRIS committee meetings and steering committee meetings this year and taking time out of your day. Thank you, Donna. IDD, intellectual and developmental disabilities. I appreciate that. Another comment in the chat from Jenny in answer to number 1. HCA and Department of Health will work on publishing, analyzing information related to the RFI for needed technology systems and tools. And then another thing that how she is planning to contribute in 2023 is drafting, publishing, and securing vendors needed for technology tools. So that is very exciting. I also wanted to mention a message that I received from Matt Gower earlier. A lot of discussion about co-responder emergency services and even improving services is going to kick off in January. So I think that directly addresses some of the concerns and questions that were being raised by Kimberly and others in the previous conversation. Other thoughts from community members about how you would like to contribute to this work in 2023, what accomplishments or outcomes have stood out for you this past year, and what remains to be done for you. Joe.
Moving on to question 2. The report itself is a major accomplishment. I think this is a historical document. And I think core to this report is the focus on equity and a population focus. Right now, the existing system, as I well know, since I oversee it, it's a one-size-fits-all system. So this is a huge change. So I think that in itself is a huge accomplishment.
Thanks, Joe. I agree with you. I was thinking the same thing when I was reading it. There's so much in here. And when you take the breadth of what's been accomplished by and discussed by subcommittees and by the CRIS committee, and then what's been done by some of the agencies, it's been pretty, and regional providers, it's been pretty tremendous. Other feedback. Brittany, can I just check in with you? I haven't been tracking time very carefully. How long do we have left here?
I was going to send the 5-minute warning out in about 3 minutes.
Okay, great. So we have 8 minutes. That's my quick math there. Okay, thank you. That's great. Other thoughts? All right, here is a message from Shram on number 1. I hope to continue to serve on the tech subcommittee. We hope you do too. Thank you so much for your contributions there. And then on number 2, accomplishment that stood out, how much the understanding of the current system has deepened and the wealth of recommendations on how to make things better. And then the answer to number 3, what still needs to be addressed. It came up a lot in CRIS feedback, but we need to put together a report card on the system in 2023 with a set of metrics across service, coverage, workforce readiness, system performance, and so on, so that we can measure against and track progress. And you are right on, Sharon. In fact, I believe that is a major step in the coming year. That's going to be a big piece of the work. So that aligns very nicely with what you're hoping will happen in 2023. Other thoughts here?
Yeah, I have one. I don't know what number it would go under, but I just think it's going to be part of our reality that all of us here, whoever, whatever stakeholder group that we're part of or are by virtue of our identification are going to really need to come together and kind of form a unified front that we're changing the system, because there are forces that are not part of this 988. I mean, they might be part of it, but they're silent or they're quiet or their cameras already are never showing their faces. But you know, there are people that are really resistant to change, and really maybe resistant to change with a capital C, to the point where no matter what we do, there won't be change. So I just think that we all have to kind of support each other, because we know things will change. This is just too dramatic of a systems, across system stakeholder situation for it not to be big change. So I just think I wanted to throw that out there as a reality in terms of the future beyond 23, but into 24 as well.
That's really important, Laura. The systems change is very, very challenging, and not the least of which because change is hard and some people are going to be resistant to it. And I hear you saying that we all can help ease that along by being really clear about how important it is that it needs to be changed. So we can start laying the groundwork for that. Thank you. We did have one room asking for a few more minutes. So we're going to do 5 more minutes, which means, I think, Brittany, you just said total of 10 minutes. That means we'll be coming back together at 4:21. So we have a little more time for a talk. I see some more comments here. So Joe is saying regarding question 3, funding. Support for the recommendations on page 66 of the report for braided funding. If we don't coordinate the funding, well, excuse me, if we don't coordinate the funding, it will be difficult to accomplish many of the goals in the report. So recommendations, not just about funding levels I'm hearing, but also how that funding is coordinated so we can achieve our goals. I'm going to take a sip of tea here, and because I got that tickly throat that so many of us have in the winter. Other thoughts or ideas in our last 9 minutes together? Here's something that's come in from the chat from Kristen. Another piece of information I didn't hear mentioned in the data overview of the current system is the criteria used for denying inpatient beds. I've had clients sent back into the community instead of entering inpatient due to things like weight, co-occurring mental health and substance use disorder diagnoses, medical diagnoses, history of aggressive disruptive behavior, etc. So it sounds like a lot of reasons people were sent out into the community instead of going into inpatient beds, but it's not clear what those criteria are or if they're being applied consistently. So thank you, Kristen. That's something to think about, food for thought with the current state layout in the report. Well, I'm going to keep these lines of communication open, but silence is also just fine. So if you need some time for quiet processing, we'll be here. We'll be bringing everyone back at 4:21. So please, I'll just stay on mute, but if I see your hand or see a chat, we'll jump back on together. So please feel free to add anything more if you think of something else you want to share. Okay, it looks like our CRIS members will be coming back in about 3 minutes. So if you think of anything else you'd like to share, please feel free to share it either by raising your hand or putting it in the chat. Of course, if you think of anything after the meeting, please email it to the HCA email box, and we'll collect that too. I'm going to put that in the chat as well. Okay, looks like CRIS committee members are coming back to the main room. Okay. Welcome back. All right, so here's what we're going to do. We're going to do a report out as we've done in past CRIS committee meetings. I'm going to ask each facilitator to share some of the key points that surfaced in their room in response to our questions, and then each subsequent facilitator to build on that. I'm going to actually start with Megan, and then I'll go with Michael, then Laura, and then Suzanne. And steering committee members, I'm going to have a special assignment for you. If there is time, I'm going to ask you to listen as well, and then offer some reflections when we get through the report outs on what you're hearing and maybe how that might impact or affect your thinking about going into 2023. We probably won't have time for all steering committees to steering committee members to share, but I do think it's nice to also just reflect what you're hearing before we go into our steering committee meeting on Thursday. So let's start with Megan. Megan, what were some of the key things that came up in your room?
Hi, everyone. Thanks so much, Jamie. So a couple of key points, and I'm sure a lot of folks have some similar things to bring up. We did talk a little bit more about mobile crisis resourcing and how mobile crisis data is going to be super important to think about a baseline of services and how we might move forward in mobile crisis response. We talked a little bit more about ethnicity and talked a little bit about diversity, ethnicity, who's accessing the system, And also, though, at the 988 entry point, how confidentiality kind of can hinder that collection of information at times, and how when folks are in crisis, it's not necessarily the best time to gain some information on demographics. And so we talked about, however, the importance of how we continue to think about diversity and ethnicity in our work, and maybe considering what Arizona did around a committee they had to inform that. And so we thought a follow-up with Arizona might help us understand a possibility for moving that forward. We did talk about significant concerns in terms of the current workforce and how we're going to negotiate and think about this in context of new things that we're bringing to the system. So how do we stabilize that workforce so we don't lose people in general? And then how do we not lose them because they're transferring to new work, you know, so then it makes old work or previous work that they were doing unstable in terms of workforce. We talked about how behavioral health is large, right? And how it's set up regionally in our state, and how this bill kind of overlays it. It's a little bit overwhelming, and it's hard to understand which things we can work on as a state, which things need to be worked on regionally, and which things need local approval, legislative approval to move forward, and trying to think about how we might organize and digest some of the information in the bill from those lenses to help provide clarity on where people can think and work to make the most impact, and understand, you know, in their sphere of accountability and responsibility, what things they should be working on. And we talked about the multiple groups in behavioral health that already meet, and sometimes the agendas and things that are going on in those venues don't align necessarily with the things that we're working on, and the cross-pollination of ideas and policy priorities, et cetera. Just that there's sometimes can be a mismatch and it's confusing. Process-wise, trying to understand a little bit more from a report perspective, how we're prioritizing all of the comments that we are receiving, and how we're thinking about these in terms of what we might do first, right? Or what we would recommend in an order of priority. And let's see, considerations as well, if we have some opportunity to push out some of our reporting in the future, to not slow what we're doing, but to try to get to a final recommendations report that's informed, prioritized, and has the key pieces put together in a way that we can move the work forward.
Thanks, Megan. So if I'm hearing, it sounds like your room spent a lot of time on question number 3 in particular, which is what still needs to be addressed. And I'm hearing a lot of consistency with that earlier discussion we had. But I also appreciate the more immediate question that maybe steering committee members we can think about in the context for our conversation on Thursday, specifically around process and what we do with all of the comments and how we think about prioritizing and tackling them in 2023. So Megan, thank you so much for that summary. Folks from Megan's room, anything to add there? Anything that we missed? Okay, sounds like Megan did a good job of capturing everything. So let's move on to Michael's room. Michael.
Yeah, thank you all. Our group talked a lot around next year maybe being kind of a year of kind of refining and focusing, right, and going into more detail around the data, filling in the gaps around what we know about the services, and then really trying to figure out a process to determine what our goals are, right? This idea of if we don't know where we're striving towards, like what is enough, not that there's ever enough, but like, how, you know, try to figure out what that need is that we're trying to get to. Folks talked around really needing to understand those kind of 3, like going deeper, refining, figuring out our goals by region, and just that the regions are very different. There are different levels of services there. There are different needs there. And we have to look at that in order to really kind of make sure that we're allocating resources to the right areas, especially rural and frontier regions. People talked about that. There was some conversation around how we spent a lot of time around talking about clinical services like 988 and mobile crisis team, but maybe we need to spend a little more time talking about crisis facilities and ENT, evaluation treatment centers, and this idea that, you know, there are a lot of folks who maybe end up in emergency rooms waiting for evaluation treatment beds, and that led to this idea of maybe there's a way to partner. I think this is, correct me if I'm wrong, group, but maybe we could partner with the health systems to get some of that data around folks who are accessing EDs who have kind of behavioral health conditions presenting that would be better served in like a crisis response, so that we can kind of get a sense of need or numbers out there, and that we don't quite have that data from the health systems just yet, but that could be a good way to help us figure out what the need is. And then there was some talk around, it would be great if we could almost like map for each of the regions, kind of what the current state is and what the needs are. And then as a state and as a committee, really look at that across regions. And so that we're making decisions based on equity around like, you know, if there's no resources here, but we have extra over there, where do we put these investments? Michael Redding said that, you know, Seattle has just done this recently and they have a map. So there's kind of a good example of that possibly out there for the group to look at. And so what does that look like if all regions have that level of map? The state, Carrie suggested that one of the good things the state can commit to doing and trying to do moving forward is not lose track of all that good work that's happening out there across all the different regions. And so how do they really kind of lift up, highlight, and further support the services that are going well, right? And that might be spread to other areas. There was some talk around making sure that we have low barrier services for folks. So, you know, sometimes if like the law enforcement is wanting to get someone into mental health services, if they're currently using substances, they may not be able to take them there. And so they have to go to the ER. So how do we make sure that the services that are available are low barrier and actually kind of meet people where they are? Someone else mentioned that, you know, when we talk about behavioral health, we talk a lot about mental health, and we can't forget to also talk about kind of alcohol and drug substance use as behavioral health issues as we move forward. So I think those are the highlights. I don't know, group, if I missed anything that you would lift up. I got a thumbs up from Carrie. Anyone else?
Nice job, Michael. Thank you. All right, let's move on to Laura's room. What would you add to or echo what you've heard so far, Laura?
Sure. Our group focused on a few things. We started with highlighting the fact that there really needs to be a current state analysis specific to the children and youth population that's different from adults. So we really just need to make sure we have a current understanding of that state for children and youth. There was a lot of discussion around police and law enforcement, how it was spoken about in the report, and actually differing opinions in our group around what police response should be. And, you know, co-response is the way to go. We need to limit police response. We need to train police up, essentially. And I think, you know, Kashi summarized it nicely. Like, there's so many differing opinions, not only in our group, but I think just in the CRIS Committee, that tension sort of needs to be addressed. So what is that role that law enforcement plays in this rollout? So that was a lively discussion. And then we also talked about making sure, of course, that the voice of consumers are heard in the process, you know, emphasizing equity. And then when we're thinking about the voice of consumers, that we're not curating those, I think that's how Michael put it, sanitizing or curating the stories of persons with lived experience. And we had, you know, a discussion about the description of the peer role in this work and making sure that it's expansive rather than narrowed. And again, sanitized, and just as a legitimate role as an alternative to support for this work. And then finally, just some discussion around what still needs to be addressed, just making sure we're really looking at access issues for the marginalized communities, including rural, agricultural, a lot of, you know, emphasis on transportation. And a call out also about access to beds, there could have been more content there in the report related to bed availability. Did anything I missed, group?
Okay, facilitators, great job so far.
Okay.
You captured things. Thanks, Laura. And steering committee members, I have a couple of kind of key takeaways that I can kick off after Suzanne goes, and then I think we might have a little time to hear some of your reflections as well. So Suzanne, anything to add or build on from what you've heard so far?
Yes, of course. Thank you, Jamie. I want our group focused on things to focus on for 2023, and I apologize for my puppy. It's quiet the entire time I'm on mute, and as soon as I take it off mute, so I apologize. But the whole discussion about the regional, how are things going to be operationalized regionally? And the conversation went to how are we going to solve for that regionally we know who's responsible for leading, who's responsible for accountability, who's responsible for pulling together stakeholders, collaboration, and that it's clear. And back to Justin's point earlier, it may be happening, but there's not clarity among stakeholders of how that's supposed to happen. And then, so to just let's nail that down, let's solve for that. I actually tried to push someone to say, well, how will the CRIS committee? And they said, it's not the CRIS committee. We just need to make sure that somehow that's solved for. The second item was about really moving forward with knowing that this past year was a soft launch with the 988 call line, but really solving for doing good marketing of the 988 line and what services are available to the community, letting the community know. And to simplify the message to just for people to call, to kind of equalize and normalize supporting people to call and not making it so convoluted and people don't want to call. The third piece about what to happen in 2023, and it mirrors what some others said, but I want to emphasize a little bit more clarity on it. But to do a true, good, in-depth analysis of what currently exists, to do a focused review of what that is. There's some work that's being, it was good to hear about what's happening in King County through Michael's report. This is happening with the co-responder models right now as we speak, that there's some review happening and it's like, how do they operate? What are their needs? What are their training needs? What happens? And documenting that information and getting a lot of good information from those workers. It was offered up that work could be emulated from the co-responder to other crisis services, or the protocol could be shared, but somehow something to that nature needed to be done. A fourth thing, a comment about the CRIS committee meeting culture. Really appreciate all the addressing the positive things that happen, but we need to also shift and have more of the time be focused on the hard conversation and rolling the sleeves up about what the challenges are and what the hard work is. And it's okay that the group has been together enough that the culture can now move towards that and people desiring that. A fifth item, and two more and I'll wrap it up, but a fifth item was a topic that's never been discussed that they'd like to have happen, has to do with the whole discussion about GPS and the area code routing, acknowledgement that a lot of that is kind of being discussed at the federal level, but regardless of that, Washington needs to have its own conversation and its own decisions and seeing what could be done around those topics. And then finally, the last thing is how to advance the role of peers in the delivery of care, and what are the strategies to move forward to really support peers in being effective in delivering care. So what are the concrete strategies that we need to move forward with? So those are the things to focus on for 2023. And if there's anything else I missed, I'd be glad to hear from some of the other very, very engaged group.
That's something we don't have to worry about with the CRIS. A lot of good engagement. Anything to add to what Suzanne shared from her room?
Yeah, can I just follow up a little bit on the geolocation?
Yes, please.
The reason why that was brought up is there were moments in the report that gave me a little bit of pause where it discussed how 988 was going to be completely confidential and that callers never had to disclose anything about themselves. And then sort of in the next paragraph, there was discussion about geolocation and how, we're looking to have technology where we can pinpoint where they're located. And it seemed a little bit of a conflict. And, the comment wasn't any sort of like decision about what kind of policy Washington state should take, but really more like, if we are moving forward with geolocation, whether or not it comes from the feds or a policy decision we make at the state level, we need to do a good job messaging to the communities about how it would work, how we would protect their confidentiality if they don't need any kind of response service. So it was really sort of tied to how are we going to message 988 so people feel comfortable to call and get the help that they need.
That's a great point, Joan, and also sounds like the implications of that as well for things like confidentiality. So, steering committee members, we have about 5 minutes to kind of hear any reflections you have. I just want to capture a couple of things. There's a lot here, and Betsy and Nicola are synthesizing the feedback that's come from the CRIS today, so we can discuss it in more depth at the steering committee on Thursday. But some big common themes that I've heard throughout this meeting today, particularly around the more detailed current state analysis that's really broken down by region, by specific demographics like children and youth, for example, but also other demographics like people of individual ethnicities or language origins or folks in rural areas. I heard a lot about having unfiltered voices. I think Michael used some great language around unsanitized. We know we don't sanitize or curate it. And then really, how do we peel this very complicated, very layered onion so we can operationalize this work regionally? Finally, and this is something that really stood out for me, what feels like maybe the elephant in the room, which is a discussion, an honest and respectful discussion with each other about the role of law enforcement in crisis response. So I think I really appreciate that coming up in a couple of rooms. Steering committee members, anyone else want to add any reflections to queue us up for our conversation on Thursday? Representative Orwell.
Thank you. One, this has just been a great meeting. I just want to thank everybody who's commented and weighed in. It's just, we've hit on so many important topics that I think we're in a good position to really tackle next year. And I do think we can make some important steps this session, but I really appreciate the sensitivity about 988 and geolocation and how we should also talk about that at the state level. I also think there's a sensitivity to how do we make sure people know about 988 and get that message out and make sure we're really building a system that's going to respond. So anyway, it's been a great discussion. Thank you.
Thanks, Representative Orwell. Any other reflections from steering committee members? I know you probably got a lot of also processing and reflecting between now and Thursday. Dr. Snowden, so you come off mute there.
Thank you. I appreciated the positive comments that people made about what's in the report. I took a lot of the feedback today as a steering committee member who on Thursday has to figure out how to keep this moving forward because we actually do have a submission date. But it does seem to me that a lot of the requests for more information, for more details on how the system will change, for who's conducting it, is the work that has to be done in the future. It's not that this report was supposed to tell the whole story, but I think we now have good info on how to revise the report a little bit, but we have a great start for the work that we've got to start next year and what will go into the report that will actually come at the end of next year. So that's the way I think about it. And we I think, made great strides towards laying out next year's work.
Thanks, Dr. Snowden. Any other thoughts from steering committee members? Michelle.
Yeah, I was just going to say one of the, just reflecting on all the comments, it's like pretty incredible that we have a group of this size and all the expertise that we have at the table. And I think it's also shows how hard some of the comments and the reflection to know where to all stay aligned on where are we going together and then what are all the different pieces of the system, because we're all bringing different aspects of expertise and slices of the pie. So I think that's one of the things we have to do together, and how do we reground every meeting about that. And I think attention point in that too is like, what are all of our hopes for kind of behavioral health and crisis system? And then what are the specifics we have to do that were in 1477? So, but I think some of the ideas that have come up about thinking about mapping it, and other ideas that are on the table is how do we bring all of it expertise and kind of level set knowledge together about what's happening. So but I'm looking forward to it. I think there was a lot of great ideas and thoughtful comments about what really needs to happen in 2023 to get to that final report.
I think it's going to be a meaty discussion on Thursday. And I also want to acknowledge that we had a really great conversation in the main room. Lots of contributions around question number 3 about what still needs to be addressed in 2023, but also a lot of compliments to you, the CRIS Committee, for all that you've accomplished this year, and a lot of enthusiasm and energy around how community members plan to contribute in 2023. So I hope that leaves you with a lot of hope and energy and inspiration going into 2023. And I, by the way, will summarize that feedback as well and make sure that's included in any summary of the proceedings today. Any other reflections from steering committee members before we go into our action items and next steps and public comment? Okay. Thank you everyone for your participation today. I really enjoyed having lots of dialogue time with you today. So action items and next steps, as I mentioned, Nicola and Betsy and the HMA team is synthesizing. It's not going to be a perfect summary. There's no way to do that between now and Thursday, but synthesizing into some key highlights, the feedback that came through the CRIS today on the report. And then we're going to be discussing it in our meeting on Thursday, our steering committee meeting on Thursday, which is 10 a.m. to noon on Thursday. Please correct me if I have that wrong. I can also look at my calendar, but I want to stay focused on your faces. So I'll ask someone else to let me know.
12 to 2 p.m.
12 to 2. I promise I'll be there. At least I had it early, not later. So if folks are available to watch, that's going to be I think a meaty discussion. And then just a reminder, CRIS committee members, your written comments are due tomorrow. And I think you can send them as late as 11:59 if you need to, but please do send your written comments tomorrow. And then the steering committee is going to provide direction on Thursday based on this conversation about how we get to, as Dr. Stone said, that December 30th submittal date. So that's the how we get from here to there. Betsy or Nicola, anything to add to next steps or action items here?
No, Jamie, you characterized well. I just want to thank everyone for such a robust discussion. I very much appreciated the feedback. I very much appreciated the themes, and it is aligning nicely with our thoughts and hopes for 2023. And we will do our best to synthesize, characterize the conversation today to take to steering committee and move things forward. So great appreciation, folks. Thanks very much.
All right. Thank you, Betsy. So we're going to move into our public comment period. I have 3 people signed up for public comment today. So I'm going to take you in order that you signed up. We have Robert Toms, followed by Brad Banks, followed by Laura Van Tosh. Just a reminder of how this works. I'm going to ask if it's available to you, if you're making a comment, if you could please, when it's your turn, turn on your video camera and unmute your mic. I'll ask you to state your full name, and then you'll have 2 minutes to make your comment. You don't have to fill a whole 2 minutes, but please keep it to a maximum of 2 minutes. And that will allow me to make sure everybody gets an opportunity to make a comment who signed up today. I'm going to share the screen with my little timer on it. It's not meant to make you feel anxious. It's just meant to help you track your time. I think that's it. And as a reminder, CRIS committee members are listening. They're not going to be responding to your comments. They're here to listen and hear what you have to say. So again, I'm going to call on Rob Toms, followed by Brad Banks, followed by Laura Van Tosh. So Rob, let me just share my screen with my timer. And when you're ready, please turn on your camera, video camera, and you may start speaking.
Yeah, thank you very much. I'm actually going to let Frank Morrison, the CEO, speak here in a second. So I'm going to make sure he's on. So if you're okay to move to the next two, Frank would be better to speak to this if that's okay.
Sorry, I just want to make sure I'm understanding. So you're not going to be making a comment. You're going to ask Frank to make one. I just want to make sure I understand.
Yes, Frank Morrison, the CEO of Core Health, and he was intending to speak, so I was hoping he'd do it over me. So
okay.
I'll make sure he's on, and then if you call on him last, he'll do it.
Certainly, happy to do that. Okay, then
Thank you so very much.
Let's go with Brad Banks, followed by Laura Van Tosh, and then we'll go to Frank when he's on. So Brad, when you're ready, please turn on your video camera and I'll start the timer.
Hi there, good afternoon, everyone. Brad Banks, work with a number of groups as part of the community behavioral health system. I really want to say I appreciate, thanks Jamie for your facilitation, but also members of the CRIS Committee, the steering committee, the subcommittees, HMA, leadership of Representative Orwell and Senator Dinkra. This is really a tremendous body of work, and you all have worked extremely hard over the last year to kind of move on a really innovative program here in Washington State. So my admiration and hats off to you for that. In kind of thinking along Senator Dingra's comments earlier, recalled for me kind of sort of Churchill's quote about this not being the end or the beginning of the end, but perhaps the end of the beginning. And as this process continues to move forward and sort of in that vein of table setting for the future, I want to take the opportunity to really strongly second the comments from a few of the committee members, Michael, Justin, and Jen, about how important it is to look at entities like our BHASOs as regional leaders and conveners and coordinators. I think that's really essential if we want this work to be successful and be able to be rolled out in a way that it really can serve the people that need it. Washington State has chosen a regional approach for its community behavioral health system, and the focus needs to be on supporting, empowering, and improving that existing system, not simply laying on the latest idea and hope that it sort of serves as a panacea. There are a number of very important issues that are still kind of maybe less flashy, but they still are barriers that remain to be mitigated. Things like reliable and fully funded transportation, nagging problems around liability, medical clearance issues, capacity-based funding, adequate training for first responders, et cetera, et cetera. And so, 988 is a fantastic additive to our community behavioral health system and a great boon for the folks that can access that and be served by that in our communities. But it's always important to be looking at that in a larger context of how it fits into that continuum of care that's out there. So I would just ask that you continue to see that sort of larger picture as you move into your work of what will be on your plates for 2023. And again, I appreciate your passion and effort. Thank you.
Thanks so much, Brad. Next up is Laura Van Tosh, and then we'll check back in to see if Frank's available. So Laura.
Thank you so much. I just wanted to relay a couple of resources. I was on 2 Zooms today. At one point, they were simultaneous at the national level. And the first was a session called Making Behavioral Health Work, in quotes. And that was provided by the Brookings Institution in Washington, D.C. And it was an excellent discussion. I actually decided to listen to it because my mentor was a panelist, Howard Goldman, and there was a number of HHS and other health experts on the panel with him talking about integration of behavioral health care. And I want to bring this up also, the HHS Secretary, Xavier Becerra, was kind of the keynote speaker in a fireside chat. And then there was this panel that I just mentioned. And I'm bringing this up because there are federal changes that are going to be before us. And I really think that we need to take those into account. There probably needs to be a couple of pages in the report that acknowledge that there's going to be some major discussion around parity within the administration coming up when they come back to session after the Christmas break. And then I called into the next session called 988 and Crisis Services National Convening. And this was put on by SAMHSA, NASHBID, and HHS as well. This was over 500 people on a Zoom. It is recorded and will be available, and I'll send the email address where people can get a copy of the session today. It was about 5 hours long. It was very well organized. And I think, again, there were some opportunities there for us. In fact, also Washington was mentioned. The new system for Indian Americans was mentioned, the STRONG program. I may be getting the title wrong, but it was a pleasure to hear Washington, a call out for Washington. I'll make those available by the email address. And again, it was very interesting afternoon to be a part of that, and then to come in here and say hello to all of you, and good luck with your work.
Thank you, Laura. And I just, I forwarded those links that you, or the information that you sent me earlier to the whole group. So.
Oh, great. Thank you so much.
So, Rob, are you ready? Or is Frank ready? Rob, are you still there? Okay, we'll give him another minute to see if
Sorry, I am. And I'm trying to see if Frank's gotten on. And if he doesn't get on here in just a second, then we will submit our comments to you in writing, and that'll be fine. It's just some feedback from what we've seen in the report thus far. So thank you very much.
Okay, great. Well, the comments in writing will also be really helpful. And in fact, that's a great note for me to make to everyone who's making comments today. If you have written comments, please do send them. Nicola or Brittany, would you mind posting the HCA email address in the chat? I have it somewhere in my chat because I posted it earlier, but I am not locating it. Okay, well, Rob, it's been, I think, a long meeting for our CRIS committee members. So if Frank's not able to join us, please do submit those comments by email, and I will just wish our CRIS committee members very healthy, happy holiday season, happy American New Year. I know many of us celebrate multiple New Years, so happy New Year that comes on January 1st. And happy all of the holidays, whatever you celebrate. I just wish you all good health, lots of happiness. And I want to express a tremendous amount of appreciation to each of you for the thoughtful, respectful, lovely way that you all engage with us and each other. And I look forward to some challenging but productive conversations in 2023. So Betsy, anything you want to add before we say goodbye?
No, thank you.
Okay.
Thank you all.
Be well, everyone. Thank you again.
Take care.
Thank you, Jamie, for your excellent facilitation. You and the rest of HMA staff have been really great. So thank you.
Oh, thank you, Joan.
Thank you, Joan. Really appreciate that. Always appreciate nice words. Thanks, folks.
Hey, Brittany, I saved the chat. I'll email it to you.
Thank you so much. Have a good night.
You too. I'll see you Thursday.
Mm-hmm.
Bye-bye.